Ananya, please start.
Good morning to one and all present. We're so glad that you're back with us after a day of amazing discussion which we had yesterday. Today would be about workshops and more such discussions, and we hope that you enjoy it just as you did yesterday. I would now like to request Miss Ekagrata, MA, Art and Design, University of Leeds, Masters in Yoga from Shivanand Ashram, Kerala. Miss Ekagrata is the founder of Ekagrata Studio and a yoga associate of Speaking Cube. I will now request ma'am to take over the stage. Over to you, ma'am.
Namaste, wonderful attendees of this beautiful program, the Perinatal Conference. And I am really very honored to be here today to discuss the incredible benefits of yoga during perinatal period. And, we say yoga is not just an exercise, but it's a holistic practice and supporting you throughout the journey during perinatal and postnatal before you commence that beautiful period and after when you have given the childbirth. It uh, it helps in the complete transformation for your mind, your body, and your spirit. During yoga can help you elevate your discomfort, improve flexibility, and promote relaxation. Very important. And it encourages mindful breathing, which is obviously your prana, the basic element of life. It encourages it helps you ease that stress that comes in during your when you commence that, when you conceive, and when you're going through those 9 months. And also postnatal yoga helps in restoring your strength, your alignments, because that's the time when you completely your body has changed. So that's the time when yoga really helps you also foster emotional balance, which is of a very uh, very great importance these days, and how women need to help themselves during this stage of their lives. Moving on, yoga is actually when you actually listen to your body. You have to listen to your body. Your body gives indications. So when you listen to your body, you're able to practice even better and mindfully. So in this stage, you cannot compare yourself with anyone, anyone in this journey, any other, because each one's journey is very unique to themselves and beautiful in their own way. There can be some kind of, you know, problems, during when you have conceived. So there can be placenta issues. So each pregnancy is very different. You can't say that this one did that, so even I can do, the same thing. The same energy levels can be very different with different people. And also, I'm going to thank you so much for allowing me to speak today for this program. And being a mother, being a new mom, I've been able to take this, few classes with myself, personal experience that I have gone through, and it's been beautiful. So, what in my experience, what I would like to actually tell everyone, learning to be teachers for a perinatal and postnatal period, you have to, the first thing is that you have to know the do's and the don'ts. Very, very important. Mainly, you need to know the don'ts. We always know what we have to do, but what about the don'ts? So I'm going to hit on few do's and don'ts very briefly before. This is the perinatal, in the perinatal period, that is before the prenatal and then the postnatal. So in the prenatal, when you begin the journey, right? That's prenatal. That's the whole 9 months journey, straight from when you conceive to giving childbirth. So in these 9 months, as you begin, the first thing that you have to do is you have to go to your healthcare specialist, healthcare provider, and consult. And here in this conference, we have, you know, eminent speakers and people, here to support and give you a very, have been giving you um, great information about this. So you have to look towards your healthcare providers and actually ask them whether you can exercise or not. Because again, I said that each journey is very different. You might not be able to do yoga or practice asanas in the first 3 months because that's the time when your embryo is getting implanted, right? So you cannot, if you've not been practicing yoga, you can't just jump into yoga and say that, no, I want to do it now because I want a, smooth childbirth. But that's not the case. You have to ask your health provider whether you can or not. Secondly, very important thing is to see, you should be well informed of the postures to be able to do. There are some postures that you have to avoid completely, right? Third is that you have to avoid any kind of strain on your abdomen, over stretching your limits. Sometimes you say, no, let's stretch, let's be more flexible, but that's the time you have to actually limit your, you know, restrictions where you cannot do certain things. I will hit upon few poses that you must do, very important one. The fourth point is that you have to hydrate and nourish yourself, which is a very important factor of what you take into your system, right? What you're eating, what you're, what your entire environment where you're breathing. So you have to be well nourished, well hydrated for yourself and your baby. And the very important fourth point is that you have to practice gentle and supported asanas, right? You have to be very gentle with yourself. So there's one thing that you have to do is you don't have to do is you can't lie down on your back for after the first 3 months, right? Because of the pressure that comes onto your abdomen, the blood flow can be restricted because of the very important vein that passes to the body, the vena cava, which I mentioned in my classes also before. The vena cava, the inferior vena cava that brings in the blood to your body and then to your womb. So if you're lying down on your back, that completely restricts the blood flow through towards your embryo. And very important thing is you don't have to lie down. When you're lying down for long hours, avoid lying down on the right side, right? Because that's where the vena cava passes through your body. So when you're lying down on the right side, it completely constricts the blood flow, right? So you must lie down on the left side of your body. So whenever you're lying down, it has to be supported, and take your props and your the wall or the chair, but you must practice with some kind of support. If you are new to yoga, if you just started practicing, also you must go in for classes or training with a well-informed instructor. The instructor has to be, have good knowledge and trained during the prenatal and postnatal. So you must go in for classes which are supported by a well-informed instructor. Now, what you should actually be doing during your prenatal yoga is whenever you're practicing yoga, you should be practicing in a well-ventilated room, nicely not like a closed, dark room. No, you can go out in the open, practice yoga there. What you should be doing is focusing on your breath a lot, right? Just simple deep breathing. You don't have to go for advanced pranayamas, no kapal bhati, right? No sort of anlom vilom. Just have to practice like deep breathing, just filling in your belly with maximum oxygen and exhaling. The next thing that you should be doing is whenever you're practicing, always keep like a cushion, you know, a bolster. If you're sitting, if you're doing sort of, you know, poses that need, when you have to, I'm going to show you like two, three poses that you should do, right? So when you're practicing in your first three stages, like your first 3 months, as as a yoga teacher, I personally advise you not to go for practicing yoga in the first 3 months. If you can, just avoid, because that's a very, very delicate period in your pregnancy. You can start after 3 months. In the first 3 months, you have to give more time to your body relaxation. You have to give time to just rest a bit. You can walk around, but try and rest. But if you have been practicing yoga for a very, very, very long time and you feel confident and you want to do it, but there are ways to do it. You cannot jump into it, you know, without giving a thought. So I'm going to tell you two poses that you should do. Firstly, if you are coming into after 3 months, that you should do is your deep squat stretching practice. So when you, this is just to open up your inner pelvic muscles, right? And also to strengthen your core. Very important. Your pelvic floor muscles and your core floor muscles have to be strong. So what you do is very gently. You can keep a pillow down there, or you can keep like a chair or a stool, there just below. And when you're practicing, you fold your palms and very gently just go. You don't have to completely go down in the first way to complete malasana. You can do that later. This I'm talking about beginners coming in and doing practicing, you know, prenatal yoga. So as you come up, and again, very gently, it has to be done like a couple of times, just 5, 6 times with your breathing. So inhale up and exhale down with your back straight. This is one very important. Whenever your body tells you no, you have to listen to your body. When your body says enough, then you must just stop there without, even giving a thought, right? If you feel sort of dizzy, you're feeling uncomfortable, just sit down. Now, the second one is that I'm going to tell you that how to lie down. Whenever you are lying down, you're picking up, firstly, when you're lying down, always take support. Always take support. Lie down on the left side of your body, right? Left side. Now, imagine that your belly has to be supported. The baby, your embryo is nicely supported. That's why you lie down on the left side. When you're doing exercises, you just open up your legs one by one, just to ease off those leg muscles, because sometimes you start getting swelling on your legs, right? Women face a lot of swelling issues. So what you have to do is rest very gently, just lift your leg up with your breathing, inhale up and down like that, right? And then gently, when you're getting up, you don't have to get up with a lot of jerk, just support it, and you sit up, right? So it's how you lie down and how you get up. And the next thing I'm going to tell you, very important, how you should lift heavy things. This is not even when you're pregnant, otherwise also, we tend to face a lot of back issues, right? Back pain, the lower back pain is a terrible thing that doesn't leave us, sometimes. So very important thing is how you're supposed to lift heavy things, okay? What we do is a big mistake. I'm going to show it to you sideways. What we do is a big mistake is we arch our back when you're lifting. Supposing, you're doing household work and you suddenly, you're lifting up your baby or you're lifting up, You suddenly go down and you lift something heavy and you get a catch on your back. And that catch can be very prolonged, that can be very prolonged pain. So you have to be very mindful of your posture that you do, right? So the posture has always to be straight with your pelvic muscles tucked in, right? Always be conscious of your posture, even being when you're in a pregnancy or not, but posture is very important. You are supposed to hold yourself upright, right? If you just leave your body like this, and it looks really ugly also. You just can't leave your body. You have to hold yourself up all the time. This is a practice. It just doesn't happen like that, but you have to practice it. So always keep your tummy in. So this is one way we leave our abdomen loose, right? No, this is the big no. Always try and tuck your tummy in. Walk with elegance, walk with a little confidence. And that confidence comes up when you hold yourself. Especially when you're pregnant, what happens is when you're holding that weight, what happens is you start arching your back. Our walk generally becomes like that. But we have to focus on a posture. We have to hold the belly, right? Whenever you're lifting something up, lift with your back muscles engaged, not loose. This is one way we lift. Supposing I'm lifting this pillow, this is one way. No, I'm completely arching my back and my back will go for a toss. When you're lifting up something, use your leg muscles, use your glute muscles, and then lift up. Makes a lot of difference. It becomes much easier also. You see there's no involvement of your lower back muscle also. When you're lifting, easy, easy. Keep your back straight. Right. So this was for your uh, prenatal, do's and don'ts that I shared with you. Moving on towards a very, very sensitive period is your postpartum, right? The postnatal period. And I'll be talking about, again, some do's and don'ts that you should be, you know, following. In your postpartum period, again, what you should be doing is first and foremost, you have to wait for your medical clearance. You cannot jump into, again, practicing uh, yoga or any sort of exercise straight after delivery, even after you've had like a normal delivery. There is a period of 6 to 8 weeks that you have to give a gap, that your medical provider will help you with that, right? And after C-section, again, it is a longer wait, but it depends on your body, how fast you're healing and how fast you're able to give in yourself with that. Now, the second point is you have to focus on gentle and restorative poses, right? Again, you cannot, like, that's the time when your body has gone through maximum changes. All your organs have moved, everything has moved within your system. There are so many hormonal changes that your body has gone through. So you have to be very gentle and you have to do restorative poses, right? Now, in this, I will tell you what pose you should not do. That's coming into my mind. So I'm just sharing with you. What we have to do is not to do anything that hangs the belly down, right? Even like a cat and cow, because our belly muscles are very loose at the moment. Our the tendons are very loose, so we have to not do anything that can loosen your abdomen even more. You have to tighten up, right? So what you have to do is wear a belt immediately after you give your childbirth, okay? And you have to do that because in the long run, then it becomes a little bit of problem for you to get back into your normal shape. And that becomes a little worry, which causes, again, leads to some depression when your body is not fine. These small things that you can take care of, right? So these days, you have nice belts available. First days used to tie that muslin cloth. Now you have nice belts, so must take care of that. Hold your tummy in, wear the belt. Again, you have to listen to your body, what your body is saying, even during that period. Um, Exercise, don't worry, if this time, just 2 months just to relax, eat, hydrate, have good nutritious food, right? No junk food, no packet opening, no, avoid processed food, that can lead to any sort of again, what, however, what if you eat good food, you're able to feel good and think good, and emotionally also you're very well. So I always suggest that food makes a very, very important part. What you're putting into your system. You have to see to that detail. Your diet plays a very important role of how you feel. Also, um, incorporate relaxation and breath work. Right? Again, nothing more important than breath that can make you feel relaxed, and it restores your energy levels instantly. So give that time to yourself, because straight after childbirth, you have a lot of things going on with your body and including your mind. So there's a lot of postpartum depression that comes in, right? So you have to guide your students to actually give that time to just sit and work on their breathing practice, right? Which immensely helps in your depression, and it doesn't let it become engraved, right? You're able to watch your thoughts, and only when you observe it you can take help from therapists, right? So um, look into your thoughts, look into yourself. If you feel that you need self help, you need guidance from therapists, you must not shy off and go for it, right? Again, I say there are you've been introduced to eminent speakers, therapists in this group, so always connect to one when needed. Now, the fifth thing that you must do is strengthen your pelvic and core muscles. That's what we have to do. And the immediate two exercises, two asanas that you can do straight after your childbirth is when you just lie down on your bed. You feel like that's completely like falling off, your abdomen. So what you can do is you lie down. So I'm going to show you two very, very, very important poses that you must tell your people, tell the students to practice is. One is the Setu Bandh Asana, right? So what you do here is on you're lying down on your bed because your body is anyway, you cannot exercise that time. So what you have to do is you keep your feet slightly closer to each other, and you place your arms straight beside your body, right? And try and touch your heel to the middle finger. That's the distance between the heel and the your palm, right? Alignment is very, very important when it comes to yoga. So keep your chin down. All you have to do is just inhale up, lift your pelvic up, and exhale down, right? Inhale up. So here when you're lifting your abdomen, your hip up, you're engaging your core muscle, you're engaging your glute muscle. Then exhale down. Again, inhale up and exhale down. So you do this a couple of times, right? Now, the second very important posture that you can do is the Kegel exercise, the Kegels. The Kegels is, you might not be able to see what I'm doing here, but I'll explain you. The Kegels is your pelvic, strengthening your pelvic muscles. So what you do is, as you inhale, you're just going to arch your back leg, and you're going to lift your tummy up, right? So here, you can see there's a space behind the back, right? Inhale up and exhale. You're just trying to push the back. There's no space. You're pushing your tummy in. You're pulling your tummy in and you're pushing the back towards the mat, right? This is a very, very important posture to do. Again, inhale up and exhale. Again, pulling your core muscles inward. Again, inhale up and exhale down. Right. You do this a couple of breaths, and again, get up with a gentle support. Now, What I'm moving on towards is the don'ts, what you should not practice during your postpartum period. Now, during the postpartum period, avoid high impact and strenuous exercises. Like you cannot just go on for a jog, right? You can't start skipping, right? You have to do exercises that take you in through your fitness very gently, right? Again, you have to connect with a trained person who is going to help you with this postpartum journey. An instructor who knows well about this, is well informed about the postnatal period. Now, you cannot rush into advanced poses as well. So you should avoid doing like uh, headstands or total inversions because your body is just coming back. Your hormones are just getting balanced again. So give yourself some time. This I'm talking when people are been practicing yoga for a couple of years and when they feel that straight after you can, but no, just give yourself some time. Now, what you should stay away from is deep twists and deep back bends, right? Why back bends? Because the abdomen doesn't need to stretch that much, right? Because it's already like loose. So give yourself time, get into postures very gently. Another important factor is do not compare yourself at all with anyone. Avoid comparing your abilities to, to your pre-pregnancy phase. We say that, oh, I was able to do this, but not this now. So avoid coming into that comparison with others and with yourself. Everybody behaves differently, and you can go through this period without comparison. Also, another important thing is avoid ignoring your discomforts. If you feel something, even emotionally, you have to take help, seek help from the person concerned, in this field. But sometimes trying to solve problems yourself doesn't work. It's always good to take help when you are in a grave problem and you're not able to understand what to do. And so during this beautiful phase, you should listen to good music, read good books, and there are nice, lovely videos to watch and um, get information about this journey, about your prenatal and postnatal period. So give yourself time, and if you're going to help someone in this phase, in this prenatal and postnatal phase, you have to be informed about this, and you have to support your person completely, emotionally, mentally, and in physical needs. You can help them to get in touch with the concerned person. Um, Also, I would like to tell you that I'm going to be starting a prenatal and postnatal yoga teachers training course during the month of November or December. I'm in between preparing this course. So if anyone would like to join or is interested, is most welcome to do so. And I I'm going to come to the end of my talk, and I'd like to thank you all once again for having me here. Thank you, Deepika ma'am, for having me to talk here to this beautiful
Now,
conference with
these
people.
thank you, Ekagrata, for a wonderful session. I hope there are certain questions because I can see
Yes,
the raised hand. Janvi, please go ahead.
please. I would love to take questions. That'd be nice to have an interactive session.
Then these 20 minutes are only for interaction. So please go ahead and ask your queries because Miss Ekagrata is our perinatal expert and have trained 2 batches already as far as the perinatal yoga is concerned. Janvi, please go ahead and ask.
Yeah. Hello, ma'am. Good morning.
Good morning.
Yeah, ma'am. I am having question that if we are doing Kegel exercise, how can
Yes.
we engage pelvic floor muscles in that?
Okay. Um, you'll have to try and do it yourself. So when you lie down, when you're doing your Kegels, you have to consciously engage. You might feel after your delivery, since I'm talking about my experience, you might feel that, oh, you're not feeling the muscles. Because if you have a cesarean, you don't feel it. That sensation is not there, right? But all you have to do is just tighten the muscle gently, squeezing in and up. So squeezing in, right? Your
Okay.
tummy, you're just pulling in. Try like exhaling. Exhaling, when you exhale, your breath is out, right? And your oxygen is out. So you automatically squeeze your tummy in, right? So as you inhale, you bloat your stomach. As you exhale, squeezing your stomach in. So this is the beginning of how you can do your Kegel with your pelvic muscle, right? Did that answer your question?
And second,
Otherwise, you'll have to book it practically with me.
yeah.
If you want to connect with me later, you can always connect with me later, and I can help you guide you through it. Right?
Okay, ma'am. Okay. Thank you.
Yes.
Thank you.
Thank you.
Yes,
Any
participants, please go ahead.
anyone else? Please bring questions. Anyone? I'm sure there must be some question ticking in your mind.
So if they do not have questions, probably it's the time for me to ask certain questions.
Yes, please.
As far as, since you have, I think, 11 plus years of experience as far as perinatal yoga is concerned, Ekagrata, I would like to ask you, when you get such kind of cases, do you feel that there is a dilemma whether we should go for it or we should not go for it? What is your experience?
Uh, as in what cases? During perinatal?
Prenatal and both postnatal.
Okay.
Basically, during this perinatal period.
Okay. So when I get such cases, so recently, when I was pregnant, I did take some classes. I did take
Yes.
online classes.
Yes.
And during that, I'm going to talk with my experience. So when I would always want to take somebody who is, especially in online class. The problem that I faced was that I could not teach somebody new to yoga, right? Because the correction is not possible on online. There are some kind of
Correct.
um, uh, what do you say? It doesn't allow you. You cannot correct like, okay, your put your arm like that, put your leg like that. And these minute alignments matter a lot in yoga, how they affect you. So I would always advise that if you are a beginner, go for physical classes and with an informed trainer, instructor. And this was what I felt. So I had to refuse to people that I'm so sorry, but I cannot teach you because it might hurt you, and
Correct.
I don't want to face anything like that. So that's one thing. But yes, if physically I didn't get the opportunity to teach somebody physically, um, because I was in that phase, I was not traveling, so we do online classes. And physically, of course, you have to, as a trainer, you know, you firstly you have to know whether that person is allowed in what stage of pregnancy. That is the first thing. If you have to, I see it like, get it written by your medical provider that yes, I am allowed to practice. If the medical practitioner says yes, and I see it and written, okay, I can go ahead with them. Because a yoga teacher and a medical
Absolutely.
practitioner is very different. You can't say, okay, they have their own, their ways of telling you, and we deal with different issues in life. So we can't mix up the both. And then for postpartum, again, I did take classes online because it's been online after
Correct.
the COVID. So again, I couldn't teach any newcomer, right? But the people who were in this journey with me during pregnancy, you know, in the 9 months and after delivery, then if they were connected with me, it's easier to teach the known, students. And here I've seen that people face a lot of depression, you know,
Absolutely.
a lot of depression. And this is today's day and age. It gets difficult for women to handle. And then they have this thing of not wanting to go and ask for help because they're shy or they're like, "Nahi, main kaise पूछ sakti hu?" I don't want to. And especially if you're living in sort of a joint family and, people might judge them that, oh, then, your in-laws might say that, "Arey, I also did it like this, I have always been in this thing. I can do it like this. I've always done. Why can't you do it?" But no, this day and age, we want women to be working and to be out there doing everything and have babies and bring them up. So it's a whole of a different scenario that women are going through. Of course, we are moving towards empowerment, and we are, that we are way more superior, if I can say in terms, than a man. We are moving to that stage right now where there's equality, believing in equality. So we are there. Um, what I'd say that you have to, as a teacher, I always told my student to seek help from a therapist. Maybe then I could not even solve that problem of, depression. What yoga can do is yoga can calm you down and uh, help the problem not aggravate, but to solve that inner problem which you cannot share, you must speak to a therapist. So that's what my take was. I hope I was able to answer
Absolutely.
your question. Yeah.
Yes. Thank you, Ekagrata. And there is one more request that I have. Can you teach certain pranayams that we can do during the antenatal period and the postnatal period?
Okay. So basically, during the your prenatal, that is your 9 months, right? 9 months, you have to avoid Kapalbhati, right? You have to avoid um, any sort of bandhas or anything. What you should be doing is just deep breathing, that is pelvic breathing. And how you should do it, I'm going to be telling you. You should sit in Sukhasana. Okay, sometimes it's not possible for people to sit in Sukhasana on the floor. You can sit on an elevated, you know, platform. Also, if you want to sit on a cushion, that's also very nice. You can sit on a cushion. So slightly, if your hip is raised, what happens is your back becomes straight. You get a little bit of support. And if that is also not possible, please take support from the, some back rest if you have some back issues. Okay, this was the posture. So you're supposed to keep your back straight. Why straight? Because there's a passage, your nadis that go down, right? If you're going to sit like this, so just imagine like, you're curling up. You're restricting the flow. So you have to sit straight. Very, very important. So pranayam cannot be done like this. No chance, not happening. So you have to sit straight, keep your shoulders upright. And now sitting straight doesn't mean pulling your chest out. Keep your shoulders relaxed. Keep your palms on your thighs rested, not hanging down, right? Keep your palms rested. Keep your palms open, your fingers open, or in Jnana Mudra, whatever feels comfortable for you. And keep your chin straight. So not looking down, not looking up, just straight so that your back, your spine is completely aligned. And you close your eyes, you inhale, take a deep breath. You can start with the ratio as 4:8. So you're supposed to exhale longer. If you exhale longer, you can take in more. That's the reason that you exhale for longer. So if you're breathing in, you do Start inhaling. Om 1, Om 2, Om 3, Om 4. If you're a beginner, please place your palm on your belly to feel the movement of inhaling. So bloating your stomach as you inhale, and as you exhale, squeezing your stomach in. And it has to be very gentle breathing, not forceful, like not like that. It has to be, breath is very smooth. So inhale smoothly in and exhale out. Inhale and exhale. Right? This is the best thing that you can do, because this is a sort of meditation, where you're only thinking of your breath and then nothing else comes to your mind, you know. So it's a great way to start off sitting into meditation also. Now, I would ask you to avoid any sort of other breathing practices. If you just do this in your prenatal, it is enough. You don't need to go into any other advanced, even Anulom Vilom. If you're not have been practicing it, please do not start doing it. Okay. Otherwise, you have to do it with your immense guidance. Now, in the postnatal, you can start doing again deep breathing aloud. You can start doing Kapalbhati, which is after 3 months, not immediately. After 3 months, you can start doing Kapalbhati, which you were not allowed to do during the whole 9 months, right? Kapalbhati is when you are exhaling out with force, removing all the toxins from your system, right? So when you do Kapalbhati, again, you sit straight the same way with your back straight, palms on your thighs, or Chin Mudra or Gyan Mudra. You sit straight and you inhale and start exhaling. So it's inhale, exhale. 1, 2, 1, 2. So only when you inhale, you can exhale, right? So 1, 2, 1, 2, 1, 2, 1, 2, 1, 2. Exhale, inhale. Stomach goes in, out, in, out. When you're in your postpartum, do not do, for very long or very strenuously. So like, you don't have to do that. Even pranayam, even Kapalbhati is done very smoothly, right? It's not literally like throwing your breath out with force. Not that with force, but gently. Like you can hear your own, but the other person sitting next to you should not be able to hear. Like, not this way, but focus on your abdomen, right? This is Kapalbhati. Very important. You can include this, and you can do Anulom Vilom when you are in your postpartum. It helps emotionally balance your right side, left side, your Ida, Pingla, Sushma, Nari. It's very, to go into the details, it helps immensely in balancing your hormones, right? So again, this is alternate nostril breathing. So how you do it? Um, you're going to put your hand to Vishnu Mudra, that is bending your index finger and your first finger, your middle finger, right? Keeping your thumb, your ring finger, and your little finger open. The other palm should be in your Gyan Mudra. Again, sitting back straight, not tilting right side or left side. Hold your back straight, starting with closing your right nostril. So gently place the tip of your thumb on your nostril, not pressing it too hard. So you close your eyes, you close your right nostril first, begin with exhaling through the left nostril. So you start exhaling, Om 1, Om 2, Om 3, Om 4. Again, close your left, exhale through your right. Again, your exhalation will be longer. So 4:8. Om 1, Om 2, Om 3, Om 4, Om 5, Om 6. Let's keep it 4:6 for beginners. Om 6. So you exhale for 6 counts. Again, from this same nostril, you're going to inhale. Inhale right. Om 1, Om 2, Om 3, Om 4. Again, close your right nostril and exhale through your left. Om 1, Om 2, Om 3, Om 4, Om 5, Om 6. Right? So this completes one cycle. You can practice this cycle about 3 to 4 times, right? In 4 to 6 ratio is good to begin with. Once you start mastering your breath, then you start going into higher ratios, like 4:8, 8:12. That's when you start practicing. So I would suggest this is as a beginner. If you want to learn more, then you should take more guided classes to learn more pranayamas and deep into pranayamas.
And
So
what I feel is, it's a very good thing that you have pointed out that people do Kapalbhati in the manner which is wrong. And this is what I have seen over a period of so many years. People do it in
yeah,
a wrong way, with giving a lot of pressure while exhaling and inhaling.
right. That's we've seen. But very important to keep your posture and your alignment and the way you breathe, because that's when you're actually benefiting your prana, your life force. So it has to be done the right way to actually feel the benefits of pranayama. And it has incredible benefits. Even if you just don't do asana, just focusing on your breath, it's it's wow.
I think we have a question. Charmi, please go
Yeah.
ahead. You can unmute yourself and go ahead, please. Charmi, you are on mute. Is there any internet issue? Charmi, you can unmute yourself and speak. You have a query, I believe. Or you can just write down in the chat box. We can take it up.
Dr. Nidhi, do you have a question?
No, Dr. Nidhi
Very good
is a
morning,
session
ma'am.
chair for the next session.
Yes.
Oh, okay.
All right. So question answers session is going on.
Yes.
All right.
Any other question, anybody? Any other doubt if you have regarding perinatal yoga?
She has raised her hand, Charmi.
Yes, ma'am. But then I think there is some internet glitch or what. She is not able to speak and
So
neither able
Ishan
to
is
write.
also there. If Ishan is there and he can ask any questions. Ma'am is already there.
Good to see you, ma'am, again. We met in the first batch of the.
Yes.
So, yeah, absolutely. The session was very, informative. And it's
Right.
always too good to, attend a session with you. Absolutely. And
Ma'am.
looking forward for more sessions.
Yeah, thank you. And definitely we are benefiting from Dr. Ekagrita, who is a yoga teacher. Although I could not attend the
Right.
whole session, but I'm very keen to learn many more pranayams. And I want to integrate in my daily routine.
You must.
Yeah.
So over to you, Ananya.
Thank you, ma'am, for a very relaxing and as well as a very powerful message behind the yoga for perinatal counseling. Moving on, I would now like to invite on stage Professor Dr. Nidhi Verma, Associate Professor, Amity University, Gurgaon, to introduce and start the discussion on psychological and psychiatric issues during perinatal period.
Ananya, please keep the video ready.
Yes, ma'am.
All right, very good morning, everyone. I welcome you in third virtual international conference on mindful perinatal mental health and the second aids. Today it's the second day. And in this session, we'll be having a panel discussion with psychiatrist, with psychologist as well. And as you all know, the theme of today's panel discussion is psychological and psychiatric issues during perinatal period. We all know it's very important and it's high time to integrate mental health into maternal health care in India. And keeping this thing in mind, we have our guest who is a psychiatrist, Dr. Raj Kiran Dhontu, who is Associate Professor of Psychiatry. And I request Dr. Rajkiran Dhontu, I think I have got a message that somehow, due to some urgent thing, he has to shift somewhere. So we have the video. If the video is available right now, please, we can play the video. And meanwhile, he'll be joining with us for any question answer round. Is it not audible to me?
This is what I'll be talking, some basic introduction. And
Now it is audible, I believe.
Yeah, I think it is audible now.
introduction. So childbirth is a difficult and exhausting process. A woman goes through a lot of hormone, physical, emotional, and psychological changes over pregnancy, as well as after the delivery of the baby. There are tremendous changes also occurring in the mother's familial and interpersonal world. So it means to say that changes are not just occurring internally, as well as in the external environment of the mother. Before and after childbirth, one can experience varied emotions ranging from joy and pleasure to sadness and crying. Now, what exactly is perinatal? This refers to period immediately before and after birth. Of course, a lot of organizations define a little differently. So, depends on who is defined. Generally, to say, starts at 20 to 28 weeks of gestation and ends at 1 to 4 weeks after. According to International Classification of Disorders version 10, it is a time period starting at 20 to completed weeks. It is 24 days of gestation and lasting through 7 days up to. What are the different psychiatric issues which we can see? During the time of pregnancy, that is prenatal, before birth, most commonly we can see depression, followed by anxiety disorders. During the postnatal period, from a spectrum of severity, it can range from postpartum blues, depression, to psychosis. According to ICD-11, these are described under mental or behavioral disorders associated with pregnancy, childbirth. When compared to ICD-11, 11 makes it very simpler. They say it as with or without psychotic symptoms. Now, syndromes associated with pregnancy are partly repetitive within 6 weeks of delivery that involve significant mental and behavioral features are the ones which are included under this head. Now, if the symptoms meet the diagnostic requirement for a specific mental disorder, that diagnosis should also be accepted. Now, moving to without psychotic symptoms, most common they can have depressive symptoms. These do not include delusions, hallucinations, or other psychotic symptoms. Common presentations under the depressive symptoms are low mood, excessive crying, difficulty bonding with the baby, withdrawing from family members, loss of appetite, or eating much more than they usually. So whether there is a decrease in appetite or increase in appetite, inability to sleep or sleeping too much. So there is either insomnia or hypersomnia, overwhelming fatigue or loss of interest, reduced interest in pleasure and usually enjoyable activities, intense irritability and anger, fear of not being a good mother, feelings of worthlessness, shame, guilt, or inadequacy, diminished ability to think clearly, concentrate, or make decisions, thoughts of harming oneself. Now, here, the symptoms stand out prominently from typical depression are difficulty bonding with the baby, fears of not being a good mother, thoughts of harming oneself or the world. Under the anxiety symptoms, common presentations could be excessive worry, general apprehensive, not restricted to any particular environmental stimulus, phobic responses, or panic attacks. Under the obsessions and compulsions, typically focusing on the newborn infant, obsessions about the baby getting hurt, contaminated, or lost, compulsive rituals involving checking mental rituals and seeking reassurance. Unwanted sexual obsessions may also be present. May also have excess avoidance, such as avoiding bathing, holding a baby in response to the obsessions. Moving on to those disorders with psychotic symptoms. Here, it can include psychotic symptoms of delusions, hallucinations, or other psychotic symptoms. Depressive and or manic mood symptoms can also be typically present. Psychotic symptoms most occur in the context of depression, mania, or mixed moods. Additional symptoms may include confusion and disorientation, sleep disturbances, excessive energy and agitation, obsessions and compulsions, paranoid ideation, and attempts to harm oneself or the baby. Moving on to individual diagnosis. First, with starting with the postpartum blues. This is defined as low mood and mild depressive symptoms. So these are transient and self-limited and are extremely common in perinatal. Symptoms can include crying, dysphoric affect, irritability, anxiety, insomnia, and appetite changes. Usually, these symptoms develop within 2 to 3 days of delivery and resolve within 2 weeks. If they persist for more than 2 weeks, then there is more likely that the diagnosis will be postpartum. Common etiological features are disturbed menstrual cycle related mood changes. So that is before the time of pregnancy, or mood changes associated with pregnancy. So during the time of pregnancy, there are any mood changes. If depression is larger number of pregnancies, or a family history of postpartum. Predisposing factors could be low social status, ethnic or racial background, gravidas status like primary parents, planned versus unplanned pregnancy, spontaneous pregnancy versus fertilization, or also type of delivery, vaginal or cesarean, and hormone changes. Now, these are viewed as occurring on a spectrum of postpartum blues being milder, postpartum depression more. When we come to the treatment, usually postpartum blues resolve on its own. Maybe a supportive psychotherapy may be of useful. Antidepressant usually are not usually resolves on its own with the supportive psychotherapy. But the important thing here is always reinforce ideation and certain ideation towards something. Moving to postpartum depression, prevalence is 1 in 7 million and on nearly half of postpartum depression grow in diabetes because of stigma around you, others in that. Disclosure may lead to abandonment and fear of pregnancy. Usually, we come across in the hospital setting because the obstetrician who has conducted the might notice some changes in the mother, or they might notice that the mother is not taking care of the infant very well. At that time, it gets noticed very easily and they have to trace. But if it is not noticed, then it becomes tougher. And mothers usually have a difficulty in understanding what they're going through. So that again makes up things. Usually, postpartum blues recover quickly, but postpartum depression tends to last long. Severely affects woman's ability to return to normal function. It affects a mother and her relationship with them. Now, this is very, very important because the mother is going through depression. So it affects the mother's relationship with her, developing relationship with the infant. And at the same time, it the affects the infant's attachment with the bonding with the mother. So in the future, it can have a different trajectory for the development of the child. Maternal brain response and behavior also complicates in postpartum. These are some of the common etiological factors. Of course, there is a huge list, but I have mentioned only some important things. So, can occur in women having depression, anxiety in any trimester of pregnancy. Psychological factors could be premenstrual syndrome, sexual abuse. Obstetric risk factors include emergency cesarean section, complications during the time of delivery. Social factors include lack of social support, domestic violence, smoking, abuse, etc. Lifestyle changes could be vitamin B6 deficiency, sleep cycle related abnormalities, or physical. Now, the diagnosis is same as for depression. Treatment, psychotherapy, and antidepressant medications are the line of management. Psychotherapy is usually the first line in cases of mild to moderate depression, especially if the mother's side is tend to start on medication. A combination of psychotherapy and antidepressant. Moving on to postpartum psychosis. Now, this is acute illness of multifactorial origin and is considered a psychiatric emergency. These factors include history of bipolar disorder, previous postpartum psychosis, family history of psychosis or bipolar disorder, schizoaffective disorder, schizophrenia, and discontinuation of psychiatric medication during the time of pregnancy. Now, this is a very important point. Usually, the caregivers and the mother feeling that psychiatric medication should not be continued during the time of pregnancy. But a consultation is very much essential. Woman becomes pregnant, whether this medication should be continued or whether changes need to be made. Prevalence is higher in patients suffering from bipolar disorder and first-time pregnancy with a fast history of bipolar disorder. Lack of sleep and hormonal fluctuations after birth, especially the rapid fall in the esophageal, may also pose a risk. Now, during the time of pregnancy, there are a lot of hormonal changes taking place in the woman's body. Now, these are very much essential for the developing effect. Soon after the death, these changes come back to normal function. So, if there is already a predisposition, if the changes are very rapid, there is a possibility that the woman can have postpartum psychosis. Now, it is an illness with a low incidence rate, but it carries the potential for serious medical and social consequences, including the risk of suicide and suicide if not promptly detected and treated. Symptoms can range from confusion, lack of touch with reality, disorganized thought pattern and behavior, odd affect, sleep disturbances, delusions, paranoia, appetite disturbances, noticeable change in the level of functioning, hallucinations, suicidal or suicidal actions. Timely identification of illness is of utmost importance as it is a psychiatric emergency. Usually has a sudden onset, brief, limited illness that responds rapidly to the mothers who are at risk or harm to themselves, the baby require immediate hospitalization because 24/7 is very much essential. Usually, under the supervision, usually will keep the infant away from the mother for the 1 week. Prophylactic treatment for women with bipolar disorder throughout pregnancy is a recommendation for women with high risk of disease. Finally, I would like to end my talk with these points. Perinatal mental health issues are those where unmet needs are quite high. Early recognition and intervention plays an important role both women and child. So with this, I would like to thank the organizers for giving me this opportunity to talk on this very important aspect of perinatal mental health issues. If there are any questions, please mail me. Thank you.
Thank you, Dr. Raj. It was very nice presentation. You have covered almost all areas and all doubts, I guess. You have discussed what is perinatal, mental health. Usually people get confused with what is perinatal and prenatal. Then you have also discussed about, ICD-10 definition. You have also covered ICD-11. What is the definition, of ICD-11? Then you have, I guess, you have covered all kinds of, treatment as well. You have covered psychotic symptoms, postpartum blues. Then you have also covered etiology, treatment, then postpartum depression and the stigma associated with that. You have also covered lifestyle problems, which is, very much prevalent in almost all, sections. If you talk about any kind of socioeconomic status, we all are having lifestyle problems, whether it is higher socioeconomic status or middle, or even everyone is having lifestyle problems. Sleep deprivation, physical inactivity is increasing these days. So you have covered that as well. So you have also covered treatment, psychotherapy and antidepressant. So in my opinion, it is a very well, um, a very good presentation, so that one can get insight of what exactly it is and how we can treat that. So now, as you are available, sir, I welcome you, and I ask participants if they have any queries, they can please go ahead. Sir is with us. Any query from the participants? If there is no query, sir, can I ask you one thing? Because I have, little, when I was writing your points, so you were also discussing about hormonal fluctuations. So can you just, throw some light on hormonal fluctuations and what can we do, to normalize it? Do we have to take medication, or it can, or we can do any other thing like pranayam or something else to, cure that? So if you can just answer this, since others are not
Yes, ma'am.
quite. Yes, please go ahead,
Yes,
sir.
ma'am. Thank you for the question, ma'am. Actually, during the time of pregnancy, the hormonal changes which take place are quite normal. So there are changes in the estrogen, estradiol. And then soon after the time of uh, delivery, again this come back to the pre-pregnancy state. Usually, it takes some time to come back, and if there is no other mental health issues, without any problem, they come back to normalcy. But if there is an underlying already predisposing factors or underlying past psychiatric illness, then this rapid changes in the hormone will cause problems. But as such, the normal changes which occur, we don't treat them. I hope
All right,
answers
sir.
your question.
Thank you, sir. Thank you, sir.
Thank you.
I have something to add. There was a case of mine, Dr. Raj, and
Yes, ma'am.
she was she was on hormonal therapy post pregnancy because of the low libido, and because
Yes.
her periods were also not normalized after the cesarean. So there are certain cases where we do hormonal therapy, I believe, because this case was a case of stress disorder turned into IBD later on. Post pregnancy, she turned into IBD.
Okay.
And then the gynecologist suggested hormonal therapy as well as CBT. So that's when the patient came to me.
There
All
must
right,
be an
ma'am.
underlying medical disorder, ma'am. So in those cases, usually they advise hormone replacement therapy, hormone therapy.
Okay. Because
Okay,
we
sir.
get these kind of cases and we do not know why the gynecologist and obstetrician has referred the case. So as a psychologist, I think we need to understand that whosoever is coming to us in the postnatal period, we need to ask about certain things. Because
Yes, ma'am. You are right.
when I asked the symptoms were of IBD, and then I said, see, before coming to me, you go to the medical specialist and start it. But then, of course, the antidepressants were not given to her because she was lactating. It was just after 1.5 month post delivery. So, such kind of cases, we have to be very clear and cautious. Thank you, Dr. Raj. Over to you, Nidhi, ma'am.
Thank you, sir. Also, ma'am,
Thank you, ma'am.
hormonal fluctuations are so common. So I think we all should be having awareness how to deal with that. Yeah. So thank you, Dr. Raj. It was a very nice presentation from you, and I hope everyone has benefited, and especially I have benefited a lot. Okay.
Thank you, ma'am.
Thank you,
Thank
sir.
you.
Thanks a lot. And now we have our next presenter. Our next presenter is Dr. Tamanna Saxena. She is a psychologist and assistant professor, uh, AIPS, Amity University, Noida. She'll also be talking about psychological and psychiatric issues during perinatal period. So I welcome Dr. Tamanna Saxena. Please.
A very good morning to everybody, and thank you so very much, Dr. Verma. And I completely resonate what you just mentioned about Dr. Raj's presentation. I think it was a wonderful presentation, and even before that, I could listen to the yoga presentation, and I think that was also wonderful. Being somebody who has been there, done that, but not utilized yoga, I think that it did add on a lot of perspectives, and very specifically in the present scenario, I think that is something we do all need to inculcate into our daily lives. And I completely echo the same thoughts that Dr. Verma mentioned, that I would also really like to incorporate into my daily routine, and I think that is what is required. And moving on to, I think Dr. Raj really has set up the bar for the very session that we have right now to talk about the psychological and the psychiatric impact, very specifically in the perinatal period. I think he gave a wonderful presentation, and he made a lot of things quite clear to each one of us, so that it is understood at a layman level also, and also at a professional domain. Now, when I have to talk about it, about the psychological impact per se, I think being a psychologist and very honestly, being a child development person, I'm a hardcore child development person, very specifically specializing in the specific area. I to talk to get down to my presentation, I would also like to put across a different perspective, that what entirely happens when you do have a lot of awareness, and rather you are aware about things, you are aware about that what are the very specific symptoms that you really need to look in for, what are the issues that can entirely be out and over there, how is this overall time period a very beautiful time period, and along with that it also comes across with its own fears, own anxieties. I think we are discussing it in this forum, but even otherwise, when we talk about pregnancy, when we talk about motherhood, when we talk about bringing about a being into this universe, into this earth, there is a overall talk associated with it. And that is what the social domain comes down to. We hear it from the very beginning, till from the time it's a young kid, we build on those schemas. As a young kid, you are being showered with all kinds of loves all around, and then as you grow, you are getting on more schemas associated with how, in any case, women have the capacity to procreate, women have the capacity to bring about a new being, how that is a wonderful process, how and if I talk about our country, even if we go by the overall psychoanalytical view, and when we are talking about the psychological domain, we get down to Dr. Kakkar's work also. So it is about putting across motherhood, childhood as something which is out there onto that pedestal. And that is the kind of aspects that we grow on with. So when we come down to a time frame, and which I would also like to talk about the very pre-conception phase also. So the very psychological stages that entirely an individual or couple goes through is starting in from the very preconception stage. In India, rather, that comes across as a very day-to-day joke. As soon as you are attending a wedding ceremony, the very first talk comes down to when are they going to plan. And very honestly, we do talk about, in the present scenario, about privacy. We do talk about how individuals are different, but if we come down to our culture, the way, and definitely our culture has a lot of beautiful entities to it also, but you will find these talks all around. Now, I'm so sorry, pardon me, I'm under the weather also. So the very first stage being about the very beliefs that are out and over there, pertaining to motherhood, pertaining to conception, pertaining to the very time frame, how and in what time it should be, which certainly adds on to the already existing anxieties, if any, the individual has picked on to. Coming down to even about the very aspect about how are they going to be as mother and father, how is the partnership going to change, is the very the relationship going to change. I think just yesterday also, where we were, while we were making those presentations, the whole idea coming down to when talking about the love languages, how the whole aspect changes, came in from this aspect only, that we go on with these very specific beliefs. And once the individual, at this stage, once when the couple is able to sail through, they move on to the next one, in which they come down to the very stage of pregnancy, very stage of the conception. And again, as sir was also mentioning, and I think Dr. Verma very categorically, I think you had put across a very important pertinent aspect, that we need to have some specific awareness about hormone fluctuations also. We hear this term uh, so randomly out and over there, that everybody is talking about it, but very honestly, we're not much aware about it. So there are times when an individual is entirely going through a different level of stress and anxiety. At times it is just been pardoned by just saying that maybe it's an hormonal fluctuation too. It may be, but in any case, yes, that really needs to be taken care of. That realization entirely needs to be over there. Now, the initial, the prenatal period, the very first trimester, which entirely does include the very period of the zygote, the period of the embryo, it is a very, very important, pertinent period for the prenatal development also. But along wise, it is also very, very important for the very mental health of the mother. And when we are saying that the woman is going through changes, no, it's not just the woman, it's the entire family. It's everybody around also going through certain changes. And each and every person has their own way of dealing in with that change and working on with that change. And coming down to or the pointer that I really started on, and which really just wanted to highlight, was what happens when one domain we do know that at times individuals are not aware about what are the symptoms, what are the parameters, what are the things they need to look in for. What if they are very well aware about those symptoms? They are well read about that domain. They know about the, at times this further adds on to the anxieties, because you are aware about the very changes that are out over there happening on a daily basis. Very specifically, the heartbeat needs to be over there after approximately these days. In any case, you should feel something happening. There needs to be morning sickness. Oh my god, there is no morning sickness, so that means that there has been something. Now these small small things add on to the stress also. So not always it is just the lack of awareness, it is also at times the being aware about a lot of aspects also, which leads on to some level of stress. I think some level of stress is also required. There's a lot of ambivalence to the whole domain, not really being aware about what it is. So in any case, that does pave way to that kind of stress, and I think at times it's required. From that, they move on to a stage at which uh, physically uh, it's visible. They are like quite known, and in India it's usually the first trimester is kept under the wraps, and moreover not informing. But as soon as you move ahead, It's all across the place. And then comes in the real time frame at which you get all kinds of advice, all kinds. I think we were having a small aspect about this, that you have all kinds of advice about what needs to be done. It happened in this manner, and along with that you have your information, your knowledge, your aspects about how things are going in and how things are happening. And over here, if I also bring about that, these are the normal stages per se. If the pregnancy is a high risk pregnancy, or comes across with it some level of issues, it certainly paves way to some more level of preparation that is required out and over there. Because in a high risk pregnancy, the very stress, the very anxiety is at times also accompanied one very, very important aspect of fear. The fear of at times loss, the fear of what if there is an issue, there is a problem per se, how and in what manner we are going to deal with it. Am I the one responsible? Am I the one who has led on to anything of this sort? So the very important parameter at in the high risk domain comes down to acceptance, accepting that yes, definitely, one, the pregnancy, as is also in the normal domain, in which they also get down to a physical entity of believing that yes, now the pregnancy is there, the infant, the fetus is out and over there, it is developing. uh, an individual with a high risk pregnancy needs to also accept and work onto a domain of accepting the pregnancy, but also facing an entire possibility of loss, it which may entirely be out and over there. And over here, if I can share on to in relation to specific cases, and not entirely trying and putting across the name per se, person X going through a high risk pregnancy, at every trimester they are informed about the possibilities, they are informed about each and every aspect that what may go wrong. Now when an information is being, which is entirely to be done by the very gynecologist, by the very doctors, by the very people, along with that, it is adding on to the all the fears and anxieties. So here comes the real role, and I think what we are trying to deliberate since yesterday, the very need of the taking care of the perinatal mental health out and over there, having very specific professionals who are dealing with these domains, like along with providing information, an aspect of how to deal with that information. Very honestly, we do provide information, we do provide awareness, but along with that, at times what goes on amiss is how to deal with it, how to work onto it. A mother being informed in the fifth month of her pregnancy that yours is a high risk pregnancy and it may lead to preeclampsia in the coming month, which is the most crucial one, and her inquiring upon that what is preeclampsia, and a doctor entirely mentioning that you may have some convulsions, you may have some issues, and the woman entirely asking, how am I going to deal with it? So the doctor, please don't worry about that, it's absolutely fine, but the only cure at times is birth. The woman in the fifth month uh, adds on to the very fear that, am I supposed to give birth in the fifth month or in the sixth month? Is my baby going to survive? The doctor does give the right information because they are supposed to give the right information ethically. They do give the right information, and that seed of fear along with a lot of anxiety is already sown out and over there. So the one and when we do talk about high risk pregnancy, at times it comes along with hypertension, it comes across with diabetes, it comes across with other conditions, and it further accentuates the whole scenario. So this is something which entirely does pave way to having help out and over there, providing an aspect of mental health care in this very time frame, so that they are able to deal in with this, along with when we come down to the very stages, the first being the acceptance for the normal pregnancy, coming down to that, yes, there needs to be accept. The next comes down to attachment. When we talk about attachment is not just something which entirely, even at layman perspective, when we understand, is not just something just after the birth. It starts in from the time period of the prenatal development per se, and they need to develop that attachment with the unborn baby, with their own body. And at times when there is a fear, anxiety, it becomes difficult to build on that attachment, which further may have its nuances onto the delivery and the latter birth. Coming down to the final, which is the preparatory aspects, the preparatory domains per se in the pregnancy, they need to be well prepared for delivery or so. That again comes across with its own aspects, information about the final trimester comes with its own nuances in terms of it being becoming difficult for them to carry on with their day-to-day tasks, some tasks which they had been undertaking, whether the delivery is going to be normal or not. We have a lot of debate about the very aspect being the cesarean birth, the normal birth, what is good, what is bad. We do know about those aspects. And if I am permitted to say, in the present scenario, if we go by, I've seen that we have come down to a stage in which the whole delivery process is glorified. We have specific kinds of rooms, we have specific kinds of packages in which it is ensured that the delivery is beautiful, everybody's out and over there, very nice. And if we do see a lot of photo shoots happening, agreed, that I think that is something which really needs to be undertaken. But along with that, that is also at times, last year we went on to doing a small kind of a small qualitative study with women who were giving birth. So just a random kind of interaction with them, that what are their stresses. Their major stresses were that how good they would be looking in the pictures that they are entirely getting done, and that is something that is further adding on to the domain. In any case, so I think when we are talking about the issues and problems that we really, I think we need to incorporate these aspects also, because coming and talking about the psychological issues, I think yes, the pertinent one are definitely out and over there. We do know about the very anxieties, the very depression, the way, but the smaller stresses, the smaller things also, which do add on to the bigger stresses, and which may have an issue with them. Now, coming down to the delivery domain, as I was mentioning, so at times, if it does not move in the direction which entirely they really wanted to, it leads on to another level of stress per se in the given domain, and which may add on to the very anxieties. And for the new mother to be coming down to the delivery domain, I think I saw Dr. Tipika, it was more over a timer kind of a thing. I think I have 5 more minutes to talk about. I'll wind up.
Yeah,
Dr. Verma,
sure.
can I just 5 minutes? Yeah.
Yes.
Thank you. So coming down to the very the post natal period after delivery or so, it's again the very glorification, the very aspect of mother being attached to the newborn as soon as the baby is born. The kind of folklore, the kind of stories that we go by is, as soon as you look at the child, you get those feelings of uh, love and affection for that very baby. Now, I may sound a bit crude onto this aspect. Not necessarily, and even through a very small kind of a research domain, what has been realized is it's not at the very first go. It does take time for the mother to develop the very feelings, the very aspects, the very emotions for the newborn. The mother is also recuperating from the delivery, whatever it's a natural birth, it's a cesarean birth. She's also, going through the very change into her body, and entirely, in any case, this very if we, even if we go by the very aspects and the theories entirely, it this overall time period, it takes in approximate, it may be a day for one, and it may be a month for another. If what may seem like a month a very big time period, it's not necessarily a very big time period. It differs from person to person entirely, but at times that also adds on another level of fear or an anxiety, that why am I not feeling the love for my child? Why am I not feeling that grieving for that my baby per se? How can I be away from my child per se? Now, the whole purpose of giving across these perspectives was also because we do have the very literature to talk about the psychological issues or so, but there are a lot of aspects pertaining to some issues which are not otherwise highlighted per se. Now, being somebody, and not just a psychologist and a child development expert per se, being a mother, I have myself gone through high risk pregnancy. I became preeclamptic. I delivered in the 6th month, and the baby had to be in the NICU. Now, when a baby is in the NICU, the baby is just out and over there, and she was there for good 2 months. Talking about the very connection, talking about the very stages that I just spoke about, I have undergone those stages entirely also, and very specifically those stages, and at that time I did feel the need to have somebody to provide in some level of solace, some level of help, so that it becomes sale worthy. So one pointer that I would really like to share along with the others, I think we were also informed about that, music really helps to calm down. There are a lot of videos that can be one aspect that entirely does help is also a lot of spirituality. Now, when I say spirituality, I do not entirely want to get down to the religiosity domain of it. Spirituality, connecting with the spirit, being in sync with your own self. That can be done through yoga, that can be done through meditation, that can be done through various kinds of practices. So incorporating the very domain into the overall perinatal period can entirely help an individuals to sail through, also to very well cognitively at the thought domain understand about the entire aspects being happening, and how and in what manner the same is to be responded in. Along with that one domain, we all know about the process of flow, and flow is being extensively studied upon. And now that is another area that we really need to work upon, to see that how entirely that can be incorporated into the overall perinatal period, in order to see that whether it can pave way to positive responses or so, being active, utilizing play. Now, when I say play, being a play therapist just always comes in, and it's not just about the kids utilizing the same. Play therapy is something which can be utilized and has been utilized with adults. It is about utilizing the components of play, the aspects of play, to let the individual be aware about their self and the very scenario out and over there. Be aware, definitely be aware of the signs, and when at times the individuals are aware of the signs, be aware of those signs mindfully. I think that is what is very well required. And at times when we do know, and there is an inflow of information everywhere, so being mindful of the very information, see a therapist whenever it is required, take help of the family. And another very, very important, the very partner being a part of the overall system. It's when we do talk about the perinatal mental health, I think we entirely need to incorporate the very father, the very individual out and over that. And along with that, also talk about the disadvantaged domain in which the family is not present, or if they're not out and over there, how entirely the individual can sail through. So just to end it across, I think I did try to think about some of the psychological issues and the aspects. Some of the aspects that I would really like to say is there is still a lacuna about how and in what manner can we intervene, and what entirely can be done at every level, starting in from, yes, at our familial level, definitely yes, but also at the medical level, at the hospital level, how entirely a perinatal mental health expert can be a part of that overall group, so that whenever an individual is out and over there, they can be provided in with that kind of an help, very specifically, so that they can sail through, and it becomes an inherent part of the overall journey, the way the very specific medications, supplements, and everything is out and over there. And I'm sure that this can entirely happen. I see it happening with yoga, I see it happening with meditation, and those are all entire very, very important chunks which are out and over there, which need to be incorporated out and over there. So I would end my talk onto that. Thank you so very much for giving me this opportunity to speak on this pertinent, important issue. So over to you, Dr. Verma. Yes.
Thank you, Dr. Tamanna, for uh, the topic which you have covered on psychosocial issues. So, yeah, you have covered almost all topic we'll be discussing later on. But before that, can we call ma'am Dr. Rupali, and then at the end we'll be taking question
Yes.
answer round? Would that be fine, Dr. Deepika?
Sure, ma'am, we can do that.
All right.
Rupali
So
ma'am
we'll
is
be
also
taking
here.
question answer at the end of the session. And
Absolutely.
then we have with us Dr. Rupali Sharma, who is a professor in Amity University in Noida. So I welcome you, ma'am, here on the second day of international conference by speaking to you. So I request Dr. Rupali Sharma, ma'am, to please start with the topic and please enlighten us. Thank you, ma'am.
Thank you, Nidhi ma'am, for the welcome, and thank you, Deepika. So in this, I think very less is left for me to say something, because all the speakers before me has said in detail, everything has been discussed. So I will not take much time, because same thing, it will be repeated again and again. So only it is better we'll give more forum to the participants to discuss. I'll give only few points from my end. So as we are discussing upon the perinatal psychological points, because I will be focusing only on the psychological points. Now, as we can say, this is a change, because when the birth, when we know about the pregnancy, when a female knows about the pregnancy, that she is pregnant, then there are different emotions that come. And similar, that is the change, because it's a new change in the life, in the normal routine, and it takes some time to sink in. And then at least for the whole family also, not only on the female, because we focus only on the pregnant women, or the women who has got the information that she's pregnant and she's having a life inside her. Even all family members also have a role to play, and they also have an effect on this, because they also have a feeling, because they also are emotionally attached. They also get information. They also feel that yes, there is something change in the family, new member is about to come in the family. And after, as we say, the perinatal period comes after the 5 to 6 months. So in that during that time, lot of the changes comes, the emotional changes, the emotional things are more there. And that is depression, anxiety, then lack of sleep, because the sleep disturbances are there, because there are changes, hormonal changes. And then the pattern also change, the life pattern also change, because you have to take care of many things. And if we are working, then we'll have to take care your working place also, your health also. So many things have to be taken care by the pregnant women. So in this, the emotional factor should be taken care of, because if those emotional factors, the psychological factors are taken care of, then the birth of healthy child will be there. Otherwise, if we are under stress, under depression, under anxiety, all these affect all these well-beings, mental health. If the mental health of the female is not good during that time, perinatal time, then it will affect the health of the baby also, which is developing inside the women and after the delivery also. So this is a very crucial period. And in India, though nowadays we are giving lot of importance to it, and now females are the pregnant women also takes care. But in rural areas, if we talk of rural areas, still there are women, they do not uh, not so much importance is given. They think that's a routine thing. So now that they also have the effect, so to see the effect of the perinatal period on the child, on the newborn baby when it is taking place, or after also, because we do not say that that duration is only during the pregnancy period only, but it have a permanent effect. It have the effect on the mental health of the female also, mental health of the family members also. Even it affects the development of the newborn baby who's going to take birth. So that's why it is important, because whatever care we'll be taking during that particular period, that will be the personality of the child for the future also. So that in that way we should take care. Now lot of work is being done, and this conference itself indicates that we are going to this side, and we'll be slowly as the workshops has also been conducted in this conference, and we can take forward this. And it's a very good area, because then we'll be more educating the people. Even educated females, females who are pregnant, they are also not aware of. We only take the gynecologist suggestions that you should not do this, your BP is high, you should do this, but we are less concerned about the psychological factors. Now this is the time we should focus, we should empower ourselves, the ladies who are the females who are during this period, and we should make aware the people or the society also. Even we should have, I would suggest, and we should work on it, that we should have a department in gynecology department itself, a separate domain. Because when we are having we are doing your physiological checkups, there should be psychological checkups also. Because there, in the 3 trimesters, you will see, if we do research in this, if we study all during the 9 months, we'll be seeing each trimester will having a different psychological changes. And those changes are more important if we focus on this, if we take care of on this. So this only I want to suggest, and I want give my point, that we should work on this, and this conference, I'm sure, will take us to that level. And the rest much have been told by my colleague, Dr. Tamanna. She has very nicely explained, and before speaker has also tell. So we should focus on the depression, anxiety level, quality of life, sleep disturbances, and the emotional factors during the perinatal period. Thank you.
Thank you, Dr. Rupali Sharma, ma'am. So we are glad to hear you. And in very short time, you have delivered, very important points. Like the Department of Gynecology, they should also consult, and they should also keep separate, what I can say, OPDs for psychologists, for counseling sessions. This is very, very important. We being psychologists, we always refer our clients to psychiatrists or other medical professionals. But this is a time, and they should also start referring their client to their patient to psychologist. This is very important, because one is not entirely healthy without when the mind is not healthy. When there is no mental health, we cannot say that it is a proper health. So for a complete health, so it is a, amalgamation of both physical and mental health. So this is very, very important topic, and we are very, glad that you spoke about these topics, about emotional factors, which are very important not only for the female but for the development of personality of the child. And it's very, very important. And you also, ma'am, point out, which I, resonate with or related with, that even educated women, those who are highly qualified, they are, because they are becoming mothers for the very first time, so they are not at all aware about what all changes are going to come and how they have to deal with it. Even their own mothers, even the family members, they are also not very much aware about it. So this is a high time that we should start creating awareness about all the issues, much before, the pregnancy takes place. So I'm very thankful to you, ma'am. And Dr. Tamanna also spoke about psychosocial issues. She spoke about, these days what is happening, social media is taking it over. The moment the child is born, people are clicking pictures and putting and pasting and posting it in the Facebook. And sometimes I also feel, the baby has just arrived and you are just exposing the baby to the entire world. No, just give some time to the baby and for the development, and then these social media can take over later on also. So these things are taking over, and probably we all have to think about it. Now I open the forum for question answer if there are any. Any participant, if they have any questions from Dr. Tamanna, Dr. Rupali Sharma, ma'am, please go ahead. So if there are no questions, but still I want to, ask, or the participants, Palak, how many of you are from Amity University? Are you all listening or not? This is all, we all are doing this for creating awareness, and you people are young generation, you have to go, ahead with this. We are only trying to create a path. Now you all have to move it.
Even
So
we need these psychologists to work in this area.
yes, ma'am. Yes, ma'am. Definitely. Actually, this is the requirement, because we all have been talking about different psychological disorders, but nobody has taken care of what is the, mental health of a mother. Because everyone takes it's a normal thing. It is go by own. ये सब अपने आप ठीक हो जाएगा. लेकिन
Right.
sometimes अपने आप ठीक नहीं होता है. कभी कभी हमें किसी की हेल्प की जरूरत होती है, तो वो कौन हेल्प करेगा? बिकॉज हमारे घर में भी हमारे पेरेंट्स, दे हैव फुल एक्सपीरियंस, बट दे आर अनेबल टू गिव एजुकेशन, मे बी दे बिकॉज ऑफ सम सोसाइटल इश्यूज कि हम कैसे बताएं, अपने आप समझ में आ जाएगा, या फिर उनको भी खुद को अवेयरनेस नहीं, क्योंकि बहुत अर्ली एज में प्रेगनेंसी हो गई, पता नहीं चला कुछ. बट नाउ डेज प्रेगनेंसीज आर नॉट टेकिंग इन अर्ली एजेस. Now we have to, I mean, create a lot of awareness. Being an educated woman, I myself did not know many things. तो अभी कुछ फ्रेंड्स हैं वो बताते हैं, तो मुझे लगता है कितना लेस अवेयरनेस है. अगर हमें ज्यादा अवेयरनेस हो तो हम इन सब प्रॉब्लम से बच सकते हैं, एंड एवरीबडी इज गोइंग टू हैव अ हेल्दी बेबी, एंड maybe late or maybe early, but we can have sail through in a very better way. And as ma'am also said, spirituality is also very important during this time, especially. वैसे तो पूरी लाइफ ही important है, पर इस टाइम पर जरूर important है. What you are thinking, how you are thinking, what are your thought patterns, whether they are positive, whether they are in touch with the supreme lord. तो ये सब चीजें एक पॉजिटिव इम्पैक्ट ही देंगी. ये सब चीजें बहुत इंपॉर्टेंट है इस टाइम के लिए भी, वैसे हर टाइम के लिए, बट स्पेशली इस टाइम के लिए, बिकॉज वट एवर वी आर थिंकिंग, आई थिंक द चाइल्ड इज गेटिंग अफेक्टेड बाय द थॉट्स. वो
Absolutely.
एक वो महाभारत में भी तो थे वो अभिमन्यु.
Abhimanyu.
Abhimanyu learned all these things during the pregnancy.
And
So
ma'am, even the recent research has very categorically pointed onto this thing that the very prenatal time period, there have been a lot of experiments in which it has been done that whatever is happening during that time period, once when they conducted the experiments with small, stories and rhymes and everything, when they tried to do the same once when the baby was born, the baby did respond in a better manner. So
Yes.
just giving way to the very importance of the same.
बहुत इम्पोर्टेंस है और बहुत सारी रिसर्चेस हो रखी हैं कि जब
हाँ जी.
मंत्रा चैंटिंग करते वी डू मंत्रा चैंटिंग वाइल प्रेगनेंसी. सो ऑल दीज थिंग्स आर गोइंग टू अफेक्ट मेंटल हेल्थ, betterment of mental health, physical health, and I guess all these things are going to get ये बेबी को आपको जरूर कुछ ना कुछ पॉजिटिव इम्पैक्ट ही देगा. इसलिए ये बहुत जरूरी है अवेयरनेस. आई हैव
And
सीन.
even I remember that during my pregnancy time, my mother-in-law, my mother used to say, keep the pictures of Bhagwan ke photo lगा
भगवान
लो,
जी. हाँ.
Ramayan padho, Roj
हाँ
bhajan suno. So
जी.
these are what? These are the same things, because to have a positive
Yes.
energy to us, to
जी.
get
Right.
more strong for to face the situation and
जी.
effect on the child itself.
बिल्कुल. Or I have seen many of my colleagues, I think, and they are very well educated, like all of us. तो उनको लगता है नहीं बेबी आएगा तभी उसको समझ में आएगा. नहीं, इट्स नॉट लाइक दैट. इट्स जस्ट आपका जब कंसीव होता है, जो लगता है उससे पहले से ही ऑल हैज स्टार्टेड. और उसमें बहुत इंपॉर्टेंट है कि आपके अंदर एंगर, एग्रेशन, यू मस्ट बी ट्राइंग टू गेट अवे विद ऑल दोज थिंग्स एंड स्टार्ट ओनली बी पॉजिटिव ड्यूरिंग दैट टाइम. एंड वैसे हमें हमेशा ही रहना चाहिए, पर उस टाइम पर भी आई हैव सीन मेनी ऑफ द एजुकेटेड women getting into some other problems or fights and all that. I think one should get away, and because not only we are living for ourselves, but it's very important for the baby. और उसकी पूरा हेल्थ अफेक्ट होता है, उसका साइकोलॉजिकल पूरा सेटअप तभी बन रहा होता है. If the mother is anxious, we have found the children, would be children, they are going to be anxious, maybe because of this or that reason. If the mother is positive, all these things are going to be carried forward by the child. So this is what
That's
my understanding is. But
and
anyone
yeah, I,
know
I I
better.
completely resonate that, and I think that is what precise. And I think what I was trying to bring on to the forum was that I have myself been a very big example for that. As I was mentioning, I had a very, very difficult, and every time the gynecologist used to inform that, anything may happen. So just think, I still remember when I was given a talk a day before my cesarean. The talk was that, see, tomorrow anything can happen. And
हाँ.
you may not even have the baby with you. And anything would be out. The one thing that really did help was not listening to anything and just focusing
Focusing.
on the positive thing, that everything. And I don't know, I think as females, as mothers, that power comes in. We have that prowess not just to procreate, but also the very power to carry on with the whole aspect. And it was moreover, and every day, even after the birth in the NICU was difficult. Every day the doctor was used to so I still remember that sentence, so far so good. Every day the doctor used to say, so far so good. Once after a week, one of the doctor was like that, please don't get attached to the baby.
Oh
She may not survive, so it will be very difficult for you.
my
I
God.
just looked and I said, fine. I till date I do not have any ill feelings for that very person, because he was informing about, he was giving the very
Physical,
information,
physical information,
yes,
right?
which was required. But what sailed through was, at times, that very emotional prowess, the very strength that you carry on with. And I believe that and that is why I very strongly believe in the power of mindful perinatal mental health, that if you really, really have that power amongst, it does resonate, it goes on. As Dr. Rupali also mentioned, that whatever is happening, howsoever the mother is, that entirely goes on to the infant per se, the fetus per se. So that, and most of the experiments, I think a lot of Western theorists and people have done a lot of experiments. But if we go back to our own literature, I think for the perinatal mental health, there's a lot available out and over there. If we rely onto it, if we work onto it, I think we can move mountains for that, and I think we can bring about very good, important, pertinent, positive change into the era, into the domain per se. I think these is what is to be required, and I completely can go by what Dr. Verma is saying. I think students and the participants who are out and over there, they really need to talk. They really need to say their pointers. I can see these students. We have Vanshika, Soumya, Sneha, Sarah, anyone who really wants to put it across.
Yeah, this is our job. I mean, apart from working on other things, but this is very, very important. We all have to join hands, and gynecologist, psychiatrist, psychologist, we all have to work together. और जैसे tools बनते हैं, we all have to start working on tool development also, in my opinion. And I mean, I have this thing in mind, and I have started working also, because ये बहुत जरूरी है कि psychological tool भी हो इस चीज का. Gynecologist के पास अपने tools हैं, अपने हैं कि भाई what is the
Absolutely.
health of the baby, what is this, and what about the psychological tools? What mother is going through? She is not a only physical entity. She has mind also. She is a person. She has emotional feelings. What she is going through, इसको tap करना भी बहुत important है. और
And the
इसको tap करने के लिए
yeah, and the physiological changes which we see during this period is most, they are, if we study, we research, we will find that they are more due to the psychological and emotional reasons.
जी
As
जी
we, for example, we generally see ki pregnant woman is, she has a high BP. Now, if we'll go back to it, if we'll do a study and we deep study it, we will find that is due to stress and anxiety.
high BP, yeah,
Yeah.
definitely.
So there, so this way there are many other things which physiological changes we give medicine, but instead of giving medicine, if we'll do counseling and that things are taken care of, then because medicine do not have the good effects. So if we are taking more medicine, you are harming your infant, your child only. So it is better to take more focus on the counseling. So
Yes.
you are right that we should be having tools. We should be doing more study in this area.
Yes. And if there is any question from the students, we can take, and then we can wind up.
I think Vanshika has
There
written a
is
message in
one
the, yeah.
Vanshika, you can unmute yourself also. We encourage all of you to please speak up and express your heart out.
Vanshika has written, as it says, it takes a village to raise a child. That include the role of a psychologist too.
हाँ, definitely, sure. ये होता ही है. Very, very rightly said. So I think we all have to work together, and we all, along with the students, you all can take up this as a part of your dissertation, part of your research project, your PhD areas, because this area is not very highlighted in India. Or abroad में UK, US, they all have, mental health practitioners also, along with the gynecologist. वहाँ पर ये it's very in thing. But in
They
India,
have perinatal counselors and perinatal therapists, ma'am.
राइट, इंडिया में ये बहुत जरूरी है. और आई बिलीव कि ये सब हम लोग इस पर भी अवेयरनेस करें. हम लोग बहुत सारे टॉपिक्स रिसर्च के लेते हैं, उसको भी हम ले सकते हैं, व्हाई नॉट. बट we can do some mini dissertations or research papers along with Rupali ma'am, along with Rita ma'am, along with Deepika ma'am. We all can work together, or we can collaborate with international faculties, and we can then collect sample of India, collect sample of different parts of the globe, and then we can have a very good research also. तो इस पर काम हम लोग जरूर कर सकते हैं, और करना भी चाहिए. Why not? जरूर करना चाहिए. And I congratulate Dr. Deepika and Dr. Rita ma'am for having this very topic, जो किसी की अवेयरनेस में नहीं आ रहा था. मतलब हम लोगों का माइंडसेट ना बिल्कुल साइकोलॉजिस्ट का ऐसा हो गया है, साइकोलॉजी. We have to think little broader also, how we can impact the society. अगर हम सिर्फ साइकोलॉजी की ही बात करेंगे तो पीपल आर नॉट गोइंग टू गेट अवेयर. वी हैव टू थिंक कि कैसे साइकोलॉजी नॉर्मल लाइफ में इफेक्ट कर रही है, कैसे वेलबींग में इफेक्ट कर रही है, कैसे मदर्स के लिए और बच्चों के लिए बहुत इंपॉर्टेंट है, आने वाली जनरेशन के लिए कितना इंपॉर्टेंट है. तो ये रोल बहुत इंपॉर्टेंट है साइकोलॉजिस्ट का. एंड आई थिंक कि हम सबको अपने रोल का अवेयरनेस होना चाहिए और हम सब अपने रोल को आगे मतलब बढ़ाएं या आगे उनको अवेयरनेस करें. कम से कम अवेयरनेस घर से स्टार्ट करें हम. वी शुड स्टार्ट फ्रॉम आवर फैमिली, उसके बाद अपने फ्रेंड्स. अब आई एम वेरी थैंकफुल टू वन ऑफ माय फ्रेंड, शी टोल्ड समथिंग, लेकिन उसने काफी लेट कुछ चीजें बताई. बट वही होता है, वी आर नॉट अवेयर. So anyways, thank you Dr. Deepika ma'am, thank you Dr. Rupali, Dr. Tamanna, Dr. Rita ma'am, and all the participants, Dr. Raj. I'm very thankful to all of you, and that's all for this session, and then we can move ahead if Dr. Deepika, you say.
Thank you, ma'am. Over to you, Ananya.
Thank you, teachers. After the most insightful and deeply analytical discussion, we move on to our next speakers. I would like to invite Dr. Deepika Chamoli, founder and director, Speaking Cube Online Mental Health Consulting Foundation, to start the workshop on perinatal mental health for to-be and new mothers and fathers. Over to you, ma'am.
Thank you, Ananya, for handing over the forum. Let me share my presentation. Is my presentation visible?
Yes.
Yes, 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 ma'am.
Okay, a very good afternoon to one and all present here. And participants, I want your presence, mental and physical presence. If you can please switch on your cameras, that's very good. If you cannot switch on your cameras, please be interactive, because it is going to be an interactive session, as it is the webinar on workshop on perinatal counseling. And you will be knowing a lot of things about the 3 trimesters and the postpartum. We will also include the management of the psychological issues and emotional issues during the perinatal period. So, all of you, please say yes.
To please switch on your camera so that at least we can have one picture together, and then you can later on do something. But I want everyone to please switch on your camera. We want to have one picture also with you. Ishan?
Yes, ma'am. Just give me 1 minute.
All right. And there are other participants also. Vanshika, Soumya, please switch on your camera for a minute only, and then you can do and listen according to your own preference. Thank you, ma'am. Anupama, ma'am, thank you so much. Vanshika, thank you so much. But
please switch on your camera so that we can have a picture together.
Right.
And later on, you can see and enjoy that yes, you have participated once upon a time in this particular conference.
Right. So it will be with you also.
Perinatal therapist also here.
Participants also, I request all of you, please, for a minute only, switch on your cameras. We want to have one picture. Tamanna ma'am, if you are there, you can also switch on. All right, ma'am, maybe people are taking some time, so you can go ahead now. If they switch on, then we'll take the picture.
Okay, participants, as you know, a few of you have already attended my workshops and my certifications. So this is going to be a very interactive session, not a one-way monologue, but a dialogue. So interact, you can, for interaction, you can unmute your microphone and speak, or else you can just write down in the chat box, but be interactive. Now, moving ahead with what perinatal is. Now, you have been listening to all the experts for 1.5 days. And probably by now you people are aware what perinatal means. But let's talk about WHO. WHO has given the guidelines for perinatal mental health, that is the mental health of the lady from conception till 1 year post-delivery. Right? WHO has given the guidelines in the year 2022 on 19th of October. The guidelines are there on the site of WHO. You can just download and see them. Right? Now, before talking about the guidelines, let me just ask you, do you think that there are a lot of perinatal therapists out there in our country? Yes, please go ahead. Do you think that there are a lot of perinatal therapists? Or we have dearth of perinatal counselors or perinatal mental health therapists? What is that?
Until now, I believe that there are not much awareness about what exactly perinatal is. Prenatal, postnatal, antenatal, everyone knows because of they have studied biology till 10th and 12th. But then how it affects the psychology and the mind of the individual, specifically talking about the ladies out there who are pregnant. So
absolutely, Ishan. So there are fistful of perinatal therapists, fistful perinatal counselors and mental health therapists. We have 2 batches. We have the second batch is just done. And Ishan, probably you are aware of it because you were from the first batch of perinatal therapists. Now, is there any need? If we have fistful, that means, what do you think? There is no need? There is no need of perinatal therapists in India? Indians are so well versed about everything. What do you think? Yes, we do need, because we are also human beings. We can be well versed. We can be jack of all trades, but probably we are master of none. So somebody needs to take a lead and be the master of at least one. Vanshika, please go ahead.
Perinatal counseling with Anganwadi, because we believe that Anganwadi is enough because they teach about nutrition, first importance of first milk, but people kind of forget that what vulnerable time the woman is going through at that time, and she needs counseling too. Because people substitute counseling, as we said in positive psychology too, but people substitute counseling with she has some problem. So pregnancy is no problem. Okay, इसके लिए जरूर रहता है.
Yes, Anganwadi workers, they do give counseling, but what kind of counseling they can give? Do you know what is the qualification of Anganwadi workers?
Yes, they just talk about nutrition, importance of first milk, but we are lacking taking care of the woman mental health in that part. And
Anganwadi workers, if I have heard you correctly, because there is a problem with the audio, Anganwadi workers, they are the ground level workers. Asha workers are the ground level workers. As we have first aid workers, right? But we do not have first aid mental health workers. Have you ever heard about the first aid mental health workers or ground level mental health workers? No, we do not have this concept in India. Remember that. We are striving hard for it, and we have already forwarded a project for this particular thing as well. But we do not have ground level mental health workers. We have psychologists, we have counselors. But what about the ground level? Right? Organizations like us who are taking things online, they are reaching out there. They are reaching to the remote areas and contacting with them because of this particular reason. Correct? So we have only fistful of perinatal counselors and mental health therapists who are professionals. Now there are certain guidelines given by WHO. Who can be perinatal counselor? Who can be mental health therapist? People are not aware who can be. Right? But before that, I would like to ask another question. Do you think that we need perinatal therapists in India? Yes or no?
Yes.
Yes. Yes, we need. As simple as that, there is a need. But do you think that an unmarried person can become a perinatal therapist? Do you feel that an unmarried person or a male person can become a perinatal therapist?
Yes, absolutely.
Yes.
Yes, but there is a gap. Definitely, an unmarried person is not experienced, and a male is also not experienced. So, keeping this point into consideration, we need to have perinatal mental health therapists who are trained with others' experiences, with others' knowledge, and expert wisdom, so that they can take things ahead in the right manner. Now, being a psychologist, we have a lot of budding psychologists, fully fledged psychologists here, and a few professors. If a pregnant lady or a father comes to you and you are unmarried or you are male, will you be able to handle the problem? Just yes or no. You do not have any idea about perinatal thing, antenatal and postnatal. You are unmarried or else you are a male. Will you be able to handle the problem? If not trained otherwise.
No, I don't think so.
Silence speaks a lot. And I have heard what your silence has just said. No, it's a big no, yes. So what is to be done? This is the reason we need to have perinatal therapists, and WHO is continuously pressurizing and harping on the fact that yes, every maternal and pediatric hospital, these are in the guidelines of WHO, every maternity and pediatric hospital should have perinatal counselors or perinatal therapists, because the gap needs to be filled. The knowledge gap, the gap of experience needs to be filled. And then only we'll be able to take the things ahead in the right manner. So considering that particular gap into, we have taken that particular gap into account and prepared this workshop for you. So that if at all you attend this 1 hour of workshop, at least you will have some knowledge about the perinatal counseling and how perinatal therapists work. And you will be able to get the guidelines that what we can do and what we cannot do. Now, as per the WHO guidelines, these are the target audience. So a lot of people keep on asking me how can you train a social worker? How can you train a nurse? How can you train a wife? So these are the guidelines given by the WHO. Doctors from any field, psychologists from any field, nurses from any specialization, social workers can be the perinatal therapist. The stipulated number of hours given by WHO is 40. And the stipulated hours that we have in our perinatal certification, 45 hours, right? So these many hours of training is required to be the perinatal therapist. So this is all about the qualification. So if at all we have some perinatal therapist over here, we should be mindful that yes, you should be able to answer. Now, what you need to understand a lady and you need to understand a couple. Just understanding the lady is not going to make a difference. Remember that. Because marriage is a unit. And when a baby is coming in the life, it is not coming in the life of a lady. It is coming in the life of a family, or especially the husband and wife. That is couple as a unit. So we need to understand a lady and a couple as a unit. Can young people understand this? Yes, definitely understand this. Yes, males definitely they can understand it. But we need to bridge the gap and emotion. You don't need to experience everything to understand it. Experience definitely gives you more insight. But if by virtue of gender, if by virtue of environment, by virtue of culture, you are not able to experience it, then you can always bridge the gap by understanding it, by being aware, by understanding the emotion, by understanding the feelings in that situation. To treat a case of depression, we do not need to be depressed. Remember that. To treat a case of a pregnancy, we do not need to be pregnant. But you can always learn from others' experiences. And that is why you need to go through a particular course in a definitive manner. Now, coming on to the perinatal period. Perinatal period is from conception till post 1 year delivery, right? But remember that in many of the books and in many of the sites, what is the technical definition of perinatal period? It is 22 weeks till 7 days post delivery. Remember that it is a medical perinatal period. It is not the psychological perinatal period. The definition of psychological perinatal period, which is conception till post year 1 delivery, it is now accepted by WHO and it was given by NHS London, National Health Services London, that the perinatal period for this particular mental health is conception till 1 year post delivery. It's very important. Now, talking about the antenatal period first. Now, what is the antenatal period? Prenatal or antenatal period. Antenatal period is conception till delivery. Before the delivery, the time is known as antenatal period, and you know that 9 months are very important. 8 to 9 months are very important. Why 8 to 9 months are very important? This antenatal period is important because we can utilize this antenatal period for psychoeducation, wherein the baby is being conceived, right? The couple has already conceived. And we can utilize it for psychoeducation. We can utilize it for changing behavior. We can utilize it for informing them the warning signs of pregnancy and childbirth, receiving social, emotional, and psychological support, right? Mothers need to understand that yes, supplementation of micronutrients is very important. Then only they'll be able to give birth to a healthy baby. And then reduction of stress and hypertension, and also immunization, which is required during this antenatal period, is important. So that's why we need to have an understanding about the antenatal period. So let's talk about the hormonal system, right? The physiology of a lady is totally different. The moment lady conceives, hormonal changes starts happening. And in every trimester, in antenatal period is divided into 3 trimesters. So 3 months, 3 months, and 3 months. That makes 9 months. And then delivery happens in the 9th month. Okay. So what happens in the first trimester, second trimester, and third trimester? So hormonal system in the first trimester is a bit different than second and third trimester, because the moment lady conceives, there is a hormone that starts building in the body of the female, and that is human chorionic gonadotropin hormone. Now, what is this hormone? Where it comes from? Is it building up, or is it being secreted by the organs which are there inside the body, or your uterus? No, it is not. Only the placenta, which is the connection between the mother and the child, mother and the fetus, right, has the potential to secrete human chorionic gonadotropin or HCG hormone. And when a lady finds out that she's pregnant, it is only because of this hormone, the presence of this hormone in the urine. So what urine test does? This urine test finds out how much HCG is there. What is the amount of HCG? is the lady pregnant? If there is a detection of HCG, lady is pregnant, right? But in few of the cases, what happens, HCG initially is low and it builds up after 2 months. And that's why for 2 months, people can get a negative report. So sometimes UPT becomes negative. It is because of the low HCG concentration in the urine, or the sample has not been taken correctly. So that you need to understand. Now moving on to other hormones. Now human placental lactogen is another hormone which is being secreted by placenta. And this prepares the body for rearing the baby. Right now, when the lady conceives, the body is not fully prepared to take care of the baby. Body slowly and gradually over a period of 9 months changes. The shape changes, the size changes, the organs also do change. You know what is the size of your heart and what is the size of your uterus? It is this much. Your fist, the uterus is of this size. And when the lady conceives, this bag stretches and stretches and stretches and becomes a big bag. And it takes, after delivery, it takes another 3 to 6 months to come back to the normal position. And that's why the lady suffers with lower abdomen, hanging lower abdomen. So body changes, the physiology goes for a 6 definitely, because a lot of changes are happening inside the body. Next hormone is estrogen, which is a female hormone, also known as a beauty hormone. So this hormone again prepares the body to take care of the baby. Next is progesterone. Progesterone is secreted by ovaries as well as placenta. And only remember that if progesterone is low, the gynecologist or an obstetrician gives the lady external hormones, that to progesterone. Why? Because this hormone is important to take care of the baby for 9 months when the baby is in utero. If it is less, there are chances of false labor. So there are a lot of cases, they say we are suffering with pseudo labors. So we have been put on duodenone and drugs like that. It's nothing but progesterone, right? So this, we are saying it's a hormonal havoc, but it is not hormonal havoc. It's a requirement of your body. Your body is being prepared to take care of a baby. And the baby is the zygote is multiplying and becoming a multi-celled structure, multicellular structure. And then the whole baby, a whole human being. Now, because of these hormones, that's because these hormones increase, right? HCG kicks in, HPL kicks in, the lady feels morning sickness. A lot of morning sickness is there in most of the cases. And this morning sickness is especially prevalent in first 3 months. In few of the cases, it continues till delivery. The lady is not able to eat properly. The lady is not able to work in the kitchen because sometimes the fragrance of the food, the smell of certain kinds can trigger it retching or vomiting. Now, what happens in the second trimester? In the second trimester, again, the body is now getting used to of these hormones, especially human chorionic gonadotropin, which is being secreted in the urine as well, right? Now, this HCG, it is because of HCG, the lady was feeling morning sickness, retching, not feeling okay all the time, having gastritis-like symptoms, right? It is only because of this HCG. Now, the HCG is being accepted by the body, and therefore, morning sickness reduces. The intensity of morning sickness reduces. And in the second trimester, just because 3 months have passed and the couple also have now started connecting with the baby, parents, they learn to deal with the symptoms together. they start internalizing the role and responsibilities of a parent, and what they are going to do in future, what should be done for the baby. In the third trimester, the levels of estrogen are at their maximum, 6 times more than or before pregnancy. And progesterone peaks at around 32 weeks. And that's why the gynecologists and obstetrician, they always say after 32 weeks, just be aware, after 34, 35, 36 weeks, okay, you can deliver anytime after 36, 37 weeks. This is the reason, right? Because now the peak has arrived and the hormones are started going down the third trimester. Prolactin is the hormone in the third trimester, and sometimes in most of the cases, what happens, it is the peak is seen in the third trimester, but sometimes it happens in the second as well, and because of which the lady can lactate after 5th month. In few cases, it happens. Now, this is the prolactin hormone that prepares the breast for breastfeeding. So the breast might even begin to bleed a little bit before the baby is born. Sometimes there is a discharge, a watery discharge, which we call as a colostrum, right? And what all physiological changes happens in the first trimester? Tenderness and swollen breast is there. There is, and it is painful. Nausea with or without vomiting is there. Increased urination because the baby bump is increasing in size, and in the second and third trimester, it is in the first trimester it is not visible, but in second and third trimester the baby bump increases and laying down the pressure on the urinary bladder, because of which increased urination is there. Food cravings are there. Heartburn is there because the intestine is also getting the pressure from the uterus, because the size of the uterus is increasing, right? So all these things happens in the first trimester, and these things keep on increasing in second and third trimester. Do you feel, now my next question is, all of you, do you feel that this is a very comfortable state? Do you feel it's a very comfortable state? Yes or no? Please
No, ma'am.
answer. A day of gastritis, just a day of gastritis is painful for everybody. And that gastritis kind of feeling with a lot of mixed emotions are also there. Now, physiologically, if all these things are happening, do you feel that psychologically nothing is happening? And this we have only shared about the lady. We have not shared the marital relationship. We have not shared anything about the environment. We have not shared anything about the workplace if she's a working lady, right? We're just quoting an example, a lady in a good family where everybody is taking care of, and she is a homemaker. So we have not taken the stressors. Now, if you take all the stresses, without the stresses, this is the condition. If she has a lot of stresses in the environment and without a happy marital relationship, can you even think of what she's going through? And do you feel that this lady doesn't need any perinatal therapist? This is the reason, we being psychologists, this is the reason. We need to understand the importance of this perinatal mental health. And perinatal mental health doesn't only mean the mental health of the lady, it is a mental health of the male partner as well. If the male partner is stressed, it will be transferred to the female. If the male partner is anxious, it is going to be transferred to the female. If the male partner is negative, it is going to be transferred to the female. And same goes to the lady. So we need to take care of these 9 months so that post 9 months can be happy and healthy. Now, there are a lot of traditional techniques with scientific background, proven techniques that do wonders. First is mindfulness. You can go for mindfulness meditation. Just pay heed to the inhalation and exhalation process, the simplest technique, mindful breathing. Mindful breathing is one of the technique of mindfulness. Anapanasati yoga, what we call in Vipassana. Just paying heed to the breath, you are inhaling and exhaling. You can go for antenatal yoga because it helps in relaxing your body and mind. And when your body and mind is relaxed, it is going to automatically relax the body and mind of the baby, which you are nurturing inside you. And there is something known as shimmering effect. And what is this shimmering effect? Anybody is aware of this shimmering effect? Anybody? Please write in the chat box. Shimmerism is a scientific effect wherein when the lady conceives, it's a foreign body, the baby is a foreign body inside the body of the female. So antibodies are released. And these antibodies which are released inside the mother because of the presence of a foreign body in the form of fetus and even a zygote, these antibodies remain throughout the life. And they heal, they have the potential to heal the cells of the mother. See, that's why there is a strong connection. We all have strong connection with our mothers. Because the antibodies that we have created are still there in them, and that's why probably they are able to know. Sitting at a different place in a different country, they know that we are not well. This is the connection. So it's not a very physiological thing, but it has got a very psychological and spiritual context behind. It is spiritual, which is why it is happening. Even a lady aborts. She is not aware, and after 1.5 months, suppose she aborts or miscarriage happens, then also the antibodies remain throughout life. Then also these antibodies can heal the cells of the mother and help the mother in healing. And see, this is the power of universe. This is the power of this perinatal period. And we must understand that. Now, marital relationship is very important as far as the perinatal period is concerned, because marital relationship sometimes goes for a 6 during all these 3 trimesters. I have seen a lot of cases wherein the lady is pregnant and husband is somewhere. The lady is emotionally very sensitive. Husband is not able to understand the emotions, is in a state of alexithymia, right? So people most of the times, they think that yes, love is same as that of sex. No, it is not. No, it is not. There is a deep connection, definitely, but it is not. But we need to understand that intimacy is, it can be physical intimacy or it is emotional intimacy. So we need to understand that maintaining a satisfactory relationship is important. In the first trimester, abstaining from the sex is required. In the second trimester, sometimes the gynecologist, they allow. And in the third trimester, again, the couple needs to be very careful. So the physical connection, the physical intimate connection is less. So what needs to be more? Things needs to be shifted to emotional connection more. And these are the 5 characteristics of maintaining good relationship, satisfactory relationship. Self-acceptance should be there. If a lady is not able to accept herself, will she be able to accept the partner or environment? No. Appreciation of each other's quality is required. Maintaining frequent positive interaction, which reduces over a period of time during perinatal period, should be more. Commitment. should be more. And good and supportive communication helps both in the antenatal period and the postnatal period. And in postnatal period, what happens? In postnatal period, the focus is on the child, not on each other. So earlier you were your own responsibility, and now your first priority and your first responsibility is your child, and it is true for both the partners. So that's why we need to understand that yes, maintaining relationship is required at least for a year post delivery as well. Otherwise, the lady can go into stress disorder, postpartum depression. Postpartum blues are very common, and postpartum blues most of the time turns into or converts into, transforms into postpartum depression. And then perinatal depression, there is a term known as perinatal depression. And then perinatal depression becomes a lifelong depression. I do and keep getting on such kind of cases that enlighten me in so many areas that yes, it happened in the perinatal period and continued till 75 years. So we need to be very mindful about it. Now, if there are any questions, please write down in the chat box. Rita, now you can share your presentation. Now, Rita ma'am, please take it ahead from intimacy onwards.
Yes. Just a minute. Give me a minute.
Sure, ma'am. Now I'm inviting Rita ma'am to take it ahead from physical relationship to the management. What can we do to take care of such kind of cases?
Thank you so much, Deepika, for giving such an elaborated idea of perinatal counseling. And good afternoon to all of you. I'll take it forward in terms of intimacy, because as till now, we have discussed that this perinatal period is a period of really the transformation, the change, because everything has been changed. How I'm saying everything has been changed? Because till now, the couple who was having a relationship, all levels of relationships are there. And this relationship was as a wife and husband only. But now, since the conception, the definition of the relationship is modified, has transformed to a next level. And that level is the level of mother and father. I hope, do you agree with me?
Yes, ma'am.
I hope everybody is here. So I would like to know from you people, what is your definition of intimacy? Any of you? Yes, Ishan.
Ma'am, if we talk about intimacy in today's point of view, then people would definitely, relate it to the physical intimacy. But for me, intimacy does not only involve physicality, but emotional, soulful, and have an understanding of each other.
Yes,
Where,
mindful.
yes,
Hmm.
wherein the other person knows that how and why the other person is feeling in a particular manner, or what stage he or she is in, and understand them. That there's both the souls are intimate
Hmm.
in the sense that they can understand each other very well. So for me, intimacy is this.
I will say, yes, very good, Ishan, that you have given a very good definition. But the intimate relationship, yes, it is regarding the couple, but it is regarding, it's a social interaction between two people, those who can share the ideas with each other, those who can share the private talks with each other, feelings with each other. It may be the partners, it may be friends, it may be other people. But yes, obviously, when we are going to talk about intimacy here, then the physical, emotional, mental, and spiritual, all the levels of intimacy are important to be discussed. As you said that, yes, being intimate does not mean to be intimate at the physical level. Because if two people are intimate at the physical level, that it's a very purposeful and very limited kind of relationship, and it cannot go for a longer period of time. But if the relationship is, we are emotionally attached, we understand the emotions of each other, if they understand their thought processes, how person might be thinking and feeling, and as per the spiritual aspect also means, because yesterday when we listened so many talks that the we all are connected at conscious, subconscious, and collective unconscious level, deeper level. So means if we are connected with each other on the deeper levels of the consciousness, that is a spiritual aspect of it, which is not clearly visible to us. But yes, we can feel and understand so many things without using the words, without saying it in the words. So that is why intimacy is very important, and intimacy is a, we can say it is an instinctual desire. It is an instinctual desire of every being on this earth, that intimate relationships are important because these heal us. These give us satisfaction. These give us feeling of happiness. These give us feeling of joy. That is why it is important to have intimate relationships. And when this is a perinatal period of time, then obviously this time is very different than other periods of the life, other times of the life. So here it is important to understand the intimate relationships as we discussed. It's not have a romantic relationship between couples only, but emotional intimacy where people can comfortably share their feeling with each other and empathize with each other. Means a relationship where we are not feeling that I'm not being understood, I'm not being listened, I'm not being taken care nicely. That is, emotional relationship is important. And this is again, physical intimacy again becomes a question during the perinatal period, as just now Dr. Deepika said, because the sexual acts and sexual relationship is also important, and to make a person to feel satisfied and loved, that is also important. So that is why these intimate relationships give us a great satisfaction, and we are able to face the life, the challenges of the life, because of these relationships. So this is, expert says that a truly intimate relationship has 5 key qualities. That key qualities are that we spend significant purposeful time together, because spending time together is very important. And those people who share their intimacy on all the levels can spend time together very nicely. And this time must be a quality time. And this time, when we are spending together, then our intimacy is more. Nowadays, when the couples are, many times the distant couples are there, the wife is working somewhere, husband is working somewhere, and family, in-laws and the parents are living in the third city or the fourth city also, then communication and spending time through media, through telephones, through video calls is important. And making each one to feel that, yes, I am present for you. I am there for you. And that is why this is not the desire of the lady only. As Dr. Deepika discussed, this men also goes through so many things when they are pregnant. So that is why, see, there is a change in the time. Previously, people used to say wife is pregnant.
Now the concept has been changed. They say we are pregnant. So this, only the lady is pregnant and we are pregnant. This has created a shifted a so much different kind of feelings. Husband also feel that much responsible and that much sharing the emotions and feelings. What he is going through means both are pregnant. And sometimes nowadays, even family feel that we are pregnant. Means if a lady is pregnant in the family, then whole family goes through this experience. And that is why spending time together make them closer to each other and closer to the baby as well. Because yesterday we listened about Kinley Lamaji, and when he was saying it's very nice thing, I liked it, that as we put some camera in some room somewhere, then it catches everything without knowing what is right, what is wrong. The same way the baby is there and catching everything, whatever is going around, how many people are there around, and they develop a indirect relationship with each and everyone present in the environment. So that is why this is very important. And uh, as this is the second important point is mutual respect is, see, I was reading somewhere, psychologist has read that if people keep on classifying each other on the rights and wrongs, okay, good and bad, then it is very difficult to live with each other. None of us is perfect in the life. Everybody has some or the other shortcomings, or I can say some other things which I may not like and other person may not like. So that is why instead of classifying the self and other into the right and wrong, a mutual respect is required. Whatever other person is feeling, trying to understand that and respecting the feeling of others, not saying, no, 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 you are feeling wrong. This should not be felt like this. Because this is not every time designed how one person is feeling. That depends on many things. If a female is feeling something during the pregnancy, then as we discussed so much, so many hormonal and biological and physiological changes are going on. That's why they are facing and feeling. So that is why it is important to respect the emotions and the feelings. Open communications are very important, and trust is important. One should not lose the trust that if somebody is reacting like this, then what is the other reasons? This should not be just losing the trust. Then how much intimacy is required into the pregnancy? That is important. How much we see, every time couple has this question in the mind, how much is required and how much is allowed, how much we desire. That is the thing. Because in this first trimester, female is going through so many stress, anxiety. Happiness is also there. Very mixed feelings are there. Then fear is also there. And this all feelings are reflecting in their behavior, and they want very much cozy and very much means loving, caring environment, so that they can feel comfortable in that. Then cooperation of partner is playing a big role, because see, yes, husbands are also going through, fathers are also going through many things, but whatever is happening in the body of the lady, that is very unique kind of thing. So that is why it is important to have the cooperation from the partners. And this is again a thing, many times we know the modern ladies, and even the previously was there also, that their independence means now moving out, and their movements, so many things are being limited somewhere, and means this is being not so much as much independent as they were before the pregnancy. So that is why this independence is again being told. They are not as much do everything as they were doing previously. Then there will be the limitation about the future also. Now their planning of the future includes this tiny life which is inside and which is going to come in their life. So that is why future planning is also very different, and they are worried about their responsibilities, because taking care of a child, nurturing a child, is a big responsibility of a mother. And when a lady is becoming a mother, always they have this question in their mind, uh, would I be able to do this correctly? How I will nurture my child? Because nurturing the child and developing the child is like, I feel is like sometimes very difficult to predict how the child will take the shape into the future. Yes, we trust on our good things, our sanskars, I can say, which we are inculcating in the child since the conception, or at the time of conception also, what kind of sanskars are being put in by the thought process of the parents, that will be there. But even then, a parent has a fear always to develop the child as a good human being. Then their sexual life is compromised, as Dr. Deepika has explained just now, and it affects the self concept and self confidence as well. Because, see, uh, to have a baby in the hand, to carry baby in the home, and to have a baby in the hand, that is also doing everything of a baby, is a big question. Would I be able to do it or not? How I will handle the child? Because it is such a small, delicate life in front of us, inside and in front. So then everything is a question. Now, if a lady goes through it, then obviously the husband also goes through it. The male partner also goes through that. Male partner also having the anxiety and stress of unknown, because many times the parents are not ready, that the child it was a sudden pregnancy, and they were not expecting, they were not planned, or they were not ready for it. That's why they fear a lot about the responsibility. They feel that, oh, we are not ready to take it. So that's why this fear is always there, and fear of loss of independence. Very nice thing. Once we were talking to Dr. Neil. I think all of you know Dr. Neil Corbin. And he said very nice thing, that when a woman get pregnant, then husband loses his wife. Now, in front of him, there is a lady who is a mother. So means all this is a very big thing for a man, that now he is losing his that wife, because wife ka center of attraction kaun tha? Husband. Now the wife's center of attraction becomes the child. So that is why this fear of losing the wife in that manner is very much in the males, and fear of playing the role of father is important. See, I want to mention it here also, that many times we are talking about motherhood, but yes, fatherhood is also very important. And father's every thought, this is true that mother is carrying the child in the womb, but whatever the father is thinking, because it is the part of the father also, then whatever the father is thinking is going on in the mind of the father, is also affecting the child. The father also goes so many things during this period. Second trimester is a very different, because in the first anxieties were more. It was a new experience. It was a new beginning. So that's why they were going through a lot. But till the second trimester, things are settled down. As it is said, now, when you throw the stone in the mud, then in the water, the mud will be activated. But as the time passes, the mud settles down. The same thing happens in the second trimester. Things have been settled down. Now they are accepting everything. They are planning. They are happy. They are enjoying. And but the complex changes in the body are there. And now the male partner has also understood about the changes in the body of the female partner, and that's why they also become more understanding. And Yes, this thing is again important as it was shared by Dr. Tamanna also, that fear of losing the independence and physical looks. This fear is because now the belly starts growing in the second trimester, the body shape starts changing, and because of this body shape is changing, the woman is worried about the looks as well. They need to change their outfits as per the body shape, but they want to look good, they want to look beautiful also. So many times, because they did not like the swollen belly, but now the belly is swollen, so they are worried about their looks also. And many times the fear of the society is there about so many other things. Then fear of physical drift from the partner is there, because yes, partners are also feeling like this. Then the how the male is going through this second trimester, anxiety, stress, and about the future is there now, because both have accepted the child in their life, they are better settled in the life, and now they are, male is also planning about the future, how he will be taking care of everything about the child. And responsibility, fear of responsibility reduces because they have accepted the responsibility, but fear of independence persists because now, being a father, they also have to cannot be so independent as they were before this. And reduction and increase of physical intimacy. So sometimes physical intimacy desire is not there, and sometimes it is there. So it depends. Sometimes it is reduced, sometimes increased. And it is again a thing that very careful sexual act is to be taken uh, during this trimester, because of the baby in the mother's womb. Third trimester is woman body has completely changed. It is not only the belly is swollen, breast size changes, complete changes in the body occurs, and so many other changes are happening inside the body. The physiological changes sometimes are very stressful, as well as we discussed about the hormonal balances and changes. And even the body, when this body size is increasing, pressure into the internal organs is increasing. So that is why when this internal organ pressure is increasing, women cannot even eat much. They are having that. That's why the nausea feelings increases in third trimester. Urination also increases. Frequent urination is there, and that is why so many internal changes are occurring. Then they are feeling a discomfort, because see, the belly weight is downwards because of the gravitational force also, it goes downwards. When it goes downwards, then the swelling in the foot happen, and that's why very uncomfortable situation, not able to even walk, to sit, to lie down. But physical activities are also important for them. So that is why some stress is good, as was discussed yesterday also, that some stress is good, that they have to do something, they have to move also. And here obviously they are looking for physical and emotional support, because they can't do everything on their own. A few things are there in which they will be needing assistance. So that's why this dependence comes with them. Male partners feeling in the third trimester is again very important and different, because they start feeling the anxiety about the delivery. And this is many times a fear whether the delivery will be known or unknown. If it's a first time pregnancy, then first pregnancy also brings so many anxiety, so many fear, because both of them do not know even about how the process will be there and how things are going to happen. Yes, they can be educated, but even the simulation is there. And As Dr. Tamanna was sharing, that doctors will say if the complexities are there, if it's a difficult pregnancy, then doctors are telling them about their what may happen in the course. That is why we can understand one side the person is very happy to have the child, another side the person is being told that you may have, you may not have. So that's why this feeling is a very fearful and very different and difficult for the mother and father to accept and to bear with it. Then financial and social stress is always there, and effect of emotional connect is there, because obviously they have a connect with the child, and father also have emotional connect. See, when a lady goes to the labor room, to the hospital, though even if things are very normal, even then the husband does not know what is going to happen inside. Nowadays even the husbands are allowed to enter into the labor room. That is even a good thing. Previously it was not allowed to enter. I had an experience when my sister-in-law was delivering this child. In the later age she was having the third child, after around she was 40, and I was asking a doctor to go me into the labor room so that I can make her comfortable, because she was very restless, but doctor was not allowing me to enter into the labor room. I Even doctor was our known one, I was not allowed to enter, but it took time. Then I asked her to allow me to enter in this for some time, and then she allowed, because that support they require at that time. Alexithymia needs to be addressed. Dr. Deepika talked about it. Alexithymia is the stage when cognitive stage of a person when they are not able to understand about the other's feeling, and female is in a high emotional state because of multiple things, and the male is at the stage of alexithymia, because they are not able to understand what the lady is going through. There can be various complications during the pregnancy. If anybody wants to ask anything or say anything, then please feel free. Though the time is running out, I'll take only few minutes, not much time I'll take. So there are various complications. Vaginal bleeding can happen, and this can be very normal sometimes. It's just, if a spotting is there, then it's a normal thing, but it can be the serious also many times, because when this happens, one should connect with the gynecologist and get the advice. Do not feel always that it's a just a spotting and bleeding, but connection is discussion with the gynecologist and advice is important, because sometimes if bleeding increases, it can cause miscarriage as well. So that is why this is important. Then excessive nausea or vomiting can happen. Fever can be there. Vaginal discharges increases. Burning. Micturations happen, means they can have vaginal burning, and then pre-medical conditions are also maybe there, which can cause more complication. Second trimester, the complication may be pre-medical conditions, as somebody is having hypertension, already the person is having hypertension, or other conditions, maybe the diabetic lady is there, or any other condition is there that can be. Leg cramps and swelling in the feet is very common. Usually women have the leg cramp and swelling, and achiness all over the abdomen is there, because the abdomen is stretching its size. So that's why there is a itching off in the abdomen. Then Braxton Hicks is there, that is pseudo contractions happen many times. Then backache, obviously backache is because pushing the backbone is happening. When the size of the abdomen is increasing, so it is pushing forward and the backward also. So that's why the backache is a very common problem during pregnancy, the second trimester. The third trimester has congestion and nosebleed many times. Discharges can happen, jaundice, vomiting, sweating, high BP, and vicarious veins can happen. So that is why this all are the complication is second trimester. Third trimester may have gastrointestinal diabetes. These diabetes happens during the pregnancy only. So sometimes this happens and this goes uh, after the birth. And preeclampsia is happen as Dr. Tamanna was discussing about, because hypertension, the lady is a case of hypertension, and it may be not previously, but it is started during the pregnancy, and they have a risk of the seizure. So during this, due to this reason, the lady may not continue the pregnancy for all the 9 months or the due time, but doctors can take a decision to do the cesarean in 7 months, seventh or eighth month, or like that, whatever is the doctors are deciding. So then that is why this is a big risk at the time. Preterm labor can happen many times due to some reasons. Preterm labor pain begins. Pre, mature rupture of membrane happens because membrane ruptures before time because of the placenta, because of the pressure, and problem with placenta can happen. Placenta previa can happen, placenta abruptions can happen, and IURG is intrauterine growth retardation can happen, means the child growth can also stop. Many times it happens that due to some reasons, the growth of the child is retarded during this third trimester. So gynecologists suggest so many things, and this can happen due to some stress and psychological things also. Then preparations can be there, and because next stage, last stage is preparation for the delivery. When the cervix dilates as labor progress and uterine muscles start to contract regularly, gradually move closer together, although more painful contractions will happen, a lot like period cramps is happening. So this is because in the last months or last days, their cervix start dilating. Then abdomen becomes hardened. Your back and pelvic may hurt as the uterus contracts. So this all can cause so many pains and problems to the lady at that time. And postnatal period, postnatal period are also the condition of the difficult, because now the new normal life has started for the couple, because this new child is there. It's normal, but it's a new normal life they have to start, because the child presence has created big difference in the life of the parent. That is why there so many things are modified: their sexual orientation, their relationships, their self identity. As I said, losing the identity of husband and wife, the identity is a new, that is mother and father. That becomes more prominent for the parents. And this is even we talked during the discussion, this panel discussion also, about baby blues. This is baby blues is when mother gets the child, means after the delivery there are so many hormonal shift into sudden shift into the body of the lady, then they may have a feeling of sadness, and this is called baby blues because after the birth they have, and usually this goes in 4 to 5 days. And this has been said that 80% of the women will go through this, and it can affect new parent of any age. income, culture, or educational level. There's no difference. So 80% of women go through this, and 2 to 5 days after delivery, postpartum, this baby blues may start, and they will be automatically settling down. But if they do not settle down and they are not taking care nicely, then the lady can have postpartum depression. So that is why this is also important to take this baby blues very nicely and deal with them in a very effective manner. Then many other psychological issues are including, as it is said, postpartum anxiety is there. Depression is very frequent. Anxiety is very frequent. This can cause due to the sudden shift into the internal hormonal and other secretions in the body. Stress is external also, because due to many reasons, the lady is even the father is in the stressful situation, because they are not able to live their life as it's a new normal life. The new normal life can cause a stress on them. Then panic disorder can also be seen. Relationship issues may occur if they are not understanding each other well. And this time, because lady is in a weaker condition, more understanding is required from the male partner and other members also. And then emotional sensitivity and insensitivity is again, and it may be again an issue. There are various techniques of management, as we have discussed previously also. That is psychotherapeutic approach. Stop card is important, because this technique is very helpful. This is a CBT technique that can make a stop card, so that whenever their disturbing thoughts are there or disturbing emotions are rising, then they can look at the stop card and they can use this card, and this can be shown very silently to the lady so that they can stop going to that zone. And mindful connection with their fetus, progressive relaxation, journaling is also important. We have discussed about the listening music, meditation, yoga, and diet, because yes, these hormonal balances can be achieved by the appropriate diet as well. Thank you so much, all of you. I will close my presentation here. If anybody wants to ask anything or say anything, feel free to for that. Any question?
Any question, anyone? Ananya, over to you. Ananya?
Yes. So thank you, Dr. Rita Kumar, and thank you, Dr. Deepika Chandrashai, for a deeply informative discussion on the certain aspects of pregnancy which we do not pay attention to. We will now be taking a break for lunch, after which 2 o'clock onwards, at the links provided, the paper presentations are going to begin. So we request all the participants who are scheduled to present their papers to kindly join on time. I would also request the others who are not presenting paper to come to join back at this same link for the continuation of our conference, because there are certain announcements we would like to make, and we look forward to having you there. Thank you.